issues that we're looking at coming into Ocean City. The convention committee is up and running and trying to prepare for that as well. The new voting process, of course, you'll hear about some of that today. I think that is going to be a lot more streamlined. I think folks will like that. And of course, you know, as Ben mentioned, the town halls, we have a couple left. So the first one wasn't very well attended, but we have 2 more left, actually 3 more left. So, you know, hopefully we can hear what your opinion is. We want to hear what you have to say so that we can address folks' concerns with that. You know, on the unfortunate side, you know, we've also gone to a few funerals and so forth and viewing. So our condolences to those that have lost department members and around the state. So if there's anything that we can do for you, let us know. We still need to continue to watch our mental health initiatives. If those are still up and running, please take advantage of those. There's a lot of good trainings coming up. We posted a lot of trainings on the MSF website. A lot of training goes on the MIMS website, the MIFRE's website. So have your personnel take advantage of these training sessions. A lot of good material that's out there and up and coming. So hopefully we'll have a good meeting. And thank you, sir.
Thank you. Vice President Carey.
My report was distributed to you today. Doyle's computer does not like my email, and it won't accept it from me. There. Like my 2 partners traveled throughout the state since their last executive committee meeting with different associations, different departments, and different committees. One of the interesting things that I'd like to bring up is I had the privilege this past Monday of attending the swearing in of their first therapy dog in Ocean City Fire Department. Little black lab is trained to basically be a friend to you. And that we've started that. We've got another one, a golden lab, that's going to come on board shortly. But they're there for the department, they're there for the employees of the city, or anybody. And be 2 of them. Nice concept, but just a loving, caring body in case you really need it. And falls in line with their mental health awareness that the association is doing. Right. So that's about all from mine. If I missed you with the signing in, get up with me and I'll sign you in. Thank you, Mr. Chairman.
Thank you. Executive Director Lovelace.
Good morning. Good morning, Mr. Chair. Thank you. My report's been handed out to all of you this morning. First, I would like to say thank you. I was not at the December meeting, but I do appreciate the executive committee moving forward with my employment status. I appreciate that. It does definitely help to in tax purposes, and it was a nice surprise when I got the text in December that it had been approved. So I thank you all for that support. The past 2 months since the December executive committee meeting, we've been busy at the MSFA in the Crofton office, navigating through the holiday season, and then we hit the ground running in the new year. Aside from everything else that we do at the office every day, I also attend the weekly legislative meetings, either in person or on Zoom, or in person in Annapolis, the monthly partner meetings such as the Training Commission, EMS Board, and SEMSAC. And I've since December staffed the MSFA table with past President Denver at the Mako Winter Conference, attended the budget and finance meetings, the town hall meeting in Bel Air, and participated in a number of Zoom calls from various committees and with our SAFER team. I won't read verbatim my report. It's also online if you'd like to read it. Just a couple of things that I'd like to highlight is our Eastern Shore Regional Recruitment Coordinator position has become available again. Tracy Johnston was promoted at her job, and she is doing that pretty much full-time and doesn't really have the availability to continue doing what she was doing for the Eastern Shore. So even though we're saddened to hear that she had to move away from the position, we're excited for her in her promotion. So if you have anyone that's on the Eastern Shore that might be interested, please send them my way. Also, I'd like everybody to take a moment and go on to the recruiter portal when you get a chance on the MSFA website and take a look at the mentorship program that the SAFER team has worked with designing. It's crucial that we try to get this mentorship program rolled out in each of your regions. We all know how important mentorship is within the fire service, and having that one person for your new members to kind of latch on to and get their experience and their information from. So please take a look at that and let me know if anyone is interested in having our recruitment coordinators roll that out in your regions. Website enhancements to the MSFA website are ongoing. I appreciate all of the committee chairs that have given me updates to their committees. I ended up giving the directory over to the web team so they can go through the directory and just do all of the committee updates from the directory itself, rather than having to wait for all the committee chairs to get those updates to me. But if you do see something that's been updated that has changed since the directory came out last year, please let me know so I can get those names updated. We do have the opportunity to get any of your forms that are on your committee pages made into online fillable forms. So you don't have to have, if you have forms for things that people need to fill out for your committee, they can be filled out directly online and emailed to you. So if you have something like that on your committee page, please let me know and we can work on getting that done. Also, with the MarylandVolunteer.org website, I do have a list from all of the recruitment coordinators of all of the departments that do not have profiles on that website. It's just another tool to use for recruitment. I know there are some departments that have your own websites, your own recruitment pages. This is just another tool for you to have. It doesn't necessarily take over for your own personal department's recruitment page, but when somebody goes onto the search engine and puts Maryland Volunteer or Volunteer Fire Department, that's the main page that comes up. So you want to make sure that your department is listed under your county. Marketing for various projects with the SAFER grant has been worked on by our marketing manager, Stephen Jenkins. He's done a few things. He's been working with Jonathan on the new trumpet design. He's created flyers for the convention, updated marketing for our pull-up displays, the logo for the Career Tech program and Queen Anne's County pilot program, and has also been working on ad marketing for the Fire News publication for this year. So if there's anything that anybody would like Stephen to help them work on, or if you have any marketing ideas, please get with Stephen. The mentorship program, again, like I said, it's listed, it's on the website. The link is actually on my report, so I won't belabor that. But if you do have any other questions on the mentorship program, please let me know. Transportation pilot program and the marketing project for Queen Anne's County Career Tech program, which was part of our SAFER grant, is moving along, and we are offering those creation of the flyers and any of the marketing to any of the other high school cadet programs that might need assistance with marketing. MFCA is continuing their training portion of the grant, so they've been, you've seen on Facebook and through all of the MFCA emails that they've been really pushing a lot of the leadership training, and I'm sure Teresa or JJ will have more information on those if you have questions. And finally, the registration portal for convention is open, so presenters, exhibitors, and sponsorships are now available. And if you are interested in anything that you need to pass out that you don't see online, please let me know. We do have a tentative seminar schedule that is created. I'm just waiting for the RFP process to close March 1st, and then that education schedule will be announced. I'll go into further details when we do the convention committee report. But that's all I have right now, Mr. Chair, if anybody has any questions for me.
Questions for Kate? Thank you.
Awesome. Thank you so much.
Secretary Cox.
Excuse me. Sun's bright this morning. Good morning. My report has been filed electronically. Should be a copy of it in your box. I requested each of you go back to your individual companies, counties, and so on, and let the individuals there know about the association. The association is always looking for members to serve on committees. There's a lot of opportunities, so spread the word. We're in the process of receiving the credentials in. Credentials are coming in very slow. We have received 47, only 47. And we should be up further than that. And I want to publicly thank President Hassler of Prince Frederick for his work through Southern Maryland. All of the credentials for Calvert County has been submitted. So if you go out and, not harass them, but encourage the member companies to submit them, it can be done. Today, one of your action items is to approve the minutes of December the 3rd and 4th at Shao and January the 17th, which was a special Zoom meeting. So if you could take care of either approving or disapproving them, appreciate it. As always, the Secretary's office is there to provide support. If any of you or anyone in the audience has a anniversary coming up, 50, 75, 80, whatever, let me know. I will take care of the appropriate action on this and have one of the presidents to make the presentation. Also, back on the Secretary's desk, you will find information on the next hotel for the executive committee meeting at Flintstone, and we'll be staying at the Fairfield Inn and Suites by Marriott in Cumberland. Phone numbers, price, everything's back there. With that, any questions?
Any questions? I'll entertain a motion to approve the minutes of December 3rd and 4th at Shao. Motion by Ron, second by Randy. Any questions? All in favor say aye. Any opposed, no. Motion carries. Entertain a motion to approve the executive committee minutes of January the 17th by Ron and by Tim. Any discussion? All in favor say aye. Opposed, no. Motion carries. Thank you.
Thank you, Mr. Chairman.
Chief Chaplain, Chaplain Long.
Good morning. I hope you all got my report electronically. If you notice on the list of names, those highlighted in yellow are ones that I have listed that were not submitted, but the companies had posted their members on their Facebook accounts or websites. At the present time, we have 10 special tributes to do, 4 line-of-duty deaths, 1 MSFA past president, 1 Ladies Auxiliary past president, 3 executive committees, and 1 committee chair. And the way it sounds this morning, we might have 1 more. I'm working close with the Maryland Memorial Foundation, and because we'll present the families with line duties in Annapolis instead of having them come to Ocean City. Between Christmas and New Year's, my wife and I went down to Myrtle Beach and we visited with Margaret Gowdy. She knew us, but she didn't know us. It's a shame to see someone suffer like that. The only other thing I have to report is I'm going to put my other hat on, my Mission Barbecue hat. If you're having banquets and stuff and you're honoring your members with awards, please get with your community ambassador from Mission Barbecue, because Mission Barbecue wants to give them something special for all their work. That's all I have.
Any questions for the chaplain's office? Thank you. And I'd like to add, Mission Barbecue has been very, very good with Bel Air. They come out to all our events. Ladies officers, I don't see a name tag. President Dalton? Is this your name? No, nobody stole them. 3 ladies took off and didn't take them. And a senior vice president didn't take hers. The junior vice president didn't take hers. President Dalton.
Well, last night at the dinner, he was giving me heck about these name tags, but we didn't know we were supposed to take them with us, so what can I say? Good morning, everybody. Nice to see everyone, and thank you to the hospitality of the Prince Frederick Fire Department. The weather is good today, but tomorrow I guess they're calling for rain. Our girls have been going to banquets and meetings, and I can't think of anything else. Let me see my paper. Oh, the legislation meeting, the reception. We really had a good time. I enjoyed meeting a lot of delegates and the senators. It was nice. We had a good time. So that's all I have to say, and I know I'm supposed to be here more than 5 minutes.
You've got another 45 minutes to cover.
Can we sing songs or something?
Thank you. Appreciate
you.
that. Jean?
Hello, everyone. It's nice to see everyone. I've been traveling throughout the state, as Malia said. Our spring conference is April the 22nd in Jarrettsville. If you need information on it, please let me know. We are here to support you. If you need anything, don't hesitate and come ask us. Thank you.
Thank you. Sherry, any? Thank you. Yes, ma'am. We can't hear you.
We forgot our past president, Elaine Hochtenlock, this morning, so I wanted to let everybody know that somebody, Mr. Ty Man, forgot. Thank you.
Thank you. Bessie Marshall, Teresa and Laurie.
Hello. Go first. You sure you want me to go first? Yep. They might not want to hear you after I talk.
Okay, so we're back. I'm just going to give you a little update of...
Well, you have to introduce yourself.
Oh, my name's Lori Dembo. I'm co-chair of the Bessie Marshall Fund. Sorry.
And Tracy Chrisman, co-chair of the Bessie Marshall.
We're here with lots of fun today. She has some hearts to hand out, but we prefer you donate money instead of taking the hearts. And another. We have a couple basket raffles today. One will go off at Spring Conference. The other one will go off at Convention. The Maryland one will go off at Spring Conference, which is April 22nd at the wonderful Harford County, and it'll be held at Jarrettsville. Our lottery raffle, we are still selling those, and we are really hoping that the executive committee members can get back to their people in their counties and ask them to either sell your tickets or bring them back. I still have a couple zeros on my list. We were at 16% sold for the MSFA. There was only 56 companies that had sold tickets. Now I'm up to 70, so we're at 20% now. I guess that's a little bit better, but I would like to see at least half, or at least get half of your companies in your counties to sell the tickets. We really depend on your income in order to keep this fund running. If you would like to know who has not bought tickets or turned their tickets in, just let me know.
No, please tell us.
Oh, I have that list over at the table, trust me. Just let me know. And the auxiliaries, they are at 35%. Wouldn't you like to know, wouldn't the MSFA like to be above the ladies auxiliary and selling these tickets? I'm sure you would. Okay, let's go on with the other. All right, I do have Susan pins because everybody needs to wear a Susan pin tomorrow. Or if you don't have one and you would like to wear it today, I have plenty. Thanks to past President Frank Underwood. We do have a flag canvas picture today. They are $1 a strip of 5. So we would like you to help us out with that.
No, it's not. That's the firing.
Oh,
The ladder.
okay.
Hello.
Looked upside down. Maybe I'm looking at it upside down. So, like I said, if you need to know which companies have not turned any in, let me know and I can help you out with that. Right now, at the beginning of September when we took over, we have a total income of $14,397 and then total expenses of $18,845. Should put my glasses on. $845.75. So we're in the negative $4,448.75. So please support us.
Hello. So right now, we have paid out $15,300 in claims. Allegheny is 1, Baltimore County is 2, Calvert is 1, Carroll is 1, Cecil County is 4, Frederick is 1, Prince George's County is 1, St. Mary's is 2, and Washington County is 2. I'm currently sitting on one case that I had to address with the member. They received the fund in 2022, and in the rules, it states that you are to, you can do it for 2 consecutive years, but it has to be for 2 different issues. This person has sent in for the same stuff. So we're working on that. Plus, to note, Bessie Marshall's on a fiscal year, not a calendar year, because when we take over in June, so it's almost like she has to wait for another year to happen. So, but we're going to work with her because it's definitely necessary. She gets the support. I also have to remind everybody, I received a case, and this is the first case that we actually had to disallow. The person moved in 2008 across the country, and they feel that they should be able to receive the fund even though they've been out of the state and they're not living in a neighboring state of Pennsylvania, West Virginia, Virginia, Washington, D.C., Delaware, or Pennsylvania. So that was a concern. So we asked this person about this, and what's kind of concerning to me is they received the fund in 2013 using someone else's address. And that is a big red flag. So he was told, and he said he's not very happy with this and that I'm denying him support. And I'm like, well, I try to help everybody, so don't tell me I'm not going to be that person to find a way to help you. But you don't qualify because you haven't been a viable member to your department. And in support of that, he was not very happy. He said he was going to call his fire chief. And anyway, when he sent the paperwork, he didn't have any of the other paperwork filled out. He told me it was my responsibility. I'm like, well, that's the wrong answer to me. So I guess I'll be hearing from him again. And then I'm still seeing old forms. We're even seeing forms that aren't even current, like they go way back. So again, I attached all the changes that we had. So when you see someone that has an old form, please correct it. I saw some stuff on the website, told Kate I got to get that fixed. One section has the right forms, and then when you just Google something, because sometimes that property just stays there, We need to get that resolved, so that will happen. So other than that, just to give you a little update on this picture was taken in Emmitsburg at the candlelight service, and I was really very impressed how I did this because I did it with a little camera phone, and this is special to us because I felt like it was something that we needed to do for the family. So in support of Bessie Marshall, I pulled this picture to have printed. So yep, so come on over and see us for this. Thank you very much. Any questions?
Any questions for Bessie Marshall?
Great.
Thank you. Please go over and buy tickets. Supports our membership.
Doyle said he's matching $1,000 to the winner.
If Doyle said it, it must be so. Miss Fire Prevention, Carolyn Little.
Hello. So this past quarter, I had the opportunity to go to a local horse farm. We talked to the kids about how to prevent barn fires, how to recognize dangerous situations that could cause a barn fire, what to do if there is a barn fire, and the most exciting part for me was we were able to give them hands-on fire extinguisher training, which I thought was really great because a lot of people don't get that opportunity to use a fire extinguisher in a non-emergency situation where they can figure it out and ask questions so they have that muscle memory when they need it. In Maryland recently, we've had a lot of barn fires. There was one in Cecil County this past week, another one in Caroline County this past week, and then last month we had one in Garrett County that killed 24 goats. So as you're taking the time and planning outreach for your company, whether it's on social media or in person, really consider talking about barn fire and barn fire safety, what to do and then to prevent it, and then what to do if it happens. And then if you are involved in a local farm at all near you, or you know someone who would like to have something like I did at that farm set up, I would love to be a part of that because I think the kids learned a lot and they really enjoyed it. I also stay active on social media, Instagram and Facebook, so you can just search MSFA, Miss Fire Prevention, and that'll come up. It's me and then my sister, so it has my picture on the profile. And as always, if there's anything that you want Ashley or I to come to, please, please, please feel free to reach out, whether it's with your company or you just know of a community event that could benefit from fire prevention. So, does anyone have any questions?
Any questions? Thank you. We appreciate all your hard work. Keep up the good work.
Thank you so much.
Thank you. Is Ashley here? I didn't see her. Okay. Okay, thank you. Board of Trustees, Doug Alexander, anything?
Thank you and good morning. I hope everybody got my report off the computer. A couple things to report. The manual review will start in the month of March. Don't think we have a whole lot this year, but as we do every year, we'll be reviewing the manual. I've again received no feedback on the appeals board personnel to this day. Currently, we have one claim pending from Stockton, Maryland, and we will be completing the disposition on that on February the 21st. We ran into just a little bit of delay on this one because of our Representative Jeff Thompson had knee surgery this week, and he was preparing for that and just got the paperwork in. And I don't want to try to hold this disposition meeting without having him there. He'll be available then the 21st, so we'll meet then and determine what we're going to do with that claim. I would ask all the executive committee members to be aware of firefighter deaths in their area. Call us if we can help in preparing or giving advice on the claim. We're getting a lot of these claims. I've had two just recently within the last month and a half where we've had a death within the fire department. They're calling asking us why they haven't received benefits. Well, it's very simple. If the fire department doesn't file a claim, there's no benefits. Both cases were widows here that seemed to think that they could file for a claim, and I had to explain to both of them that that's not the case. One was a death from several years ago. One was a death back in, I think, August or September of last year. So on these things, when you get these deaths, if there's any questions, please give us a call and we can give you an idea whether or not it's got a chance of making it qualifying for the benefits, or if they need to work towards a claim. Another thing I want you to remember is that many fire departments are calling deaths line of duty that do not meet the qualifications for trustee benefits. I mean, we're seeing these line of duty deaths pop up everywhere, and they do not qualify for trustee benefits. So just because you hear a line of duty death does not mean the trustees have had anything to do with it. Okay? And be sure to understand that the fire department, the volunteer fire department to which that the deceased belongs, has to file the claim. Okay? It has to be filed by the fire department, not somebody else. And last but not least, I heard Teresa there talking about some of the callbacks and so forth. We're getting the same thing, Teresa. I know exactly how you feel. We're getting people calling, wanting to know why we didn't do this or why we have to do that or who makes the rules for us and this, that, and the other thing. And it takes a lot of patience to explain. We've had some success since we've put the procedural manual on the website. It's pretty easy to talk to them on the phone and refer them to that procedural manual, and they'll download it and see that we're not making this up as we go. It's in writing and it's there to be seen. So, and I would just urge, anytime you have a death in the fire department, even if you don't think it's a line of duty, at least give us a call. We can tell you whether or not we think it's going to qualify. If you don't want to go through all the paperwork or whatever, that's fine. Certainly we can at least point you in the right direction. I'm not going to tell you we're going to be absolutely golden every time, but we can at least give you an idea what's going on. That's it for today. Questions? Thank you.
Thank you, Doug. Appreciate that. Attorney Mike Farlow.
Just a brief report this morning. In the next few weeks, I'll be getting in touch with some of the committee heads to get some information for the trademark renewal. We'll have to submit samples of current use of objects. So some of it's fairly easy to get, high-resolution images, stuff off of the web page. Some of it I've got to figure out whether we need a physical example or not. For instance, if do we even still sell glasses, mugs, things like that? Because that's one of the trademarks that we have. I don't even know if we're still selling those, so we may not be eligible for that renewal, but t-shirts, that sort of thing. So other than that, progress. Questions?
Any questions for the attorney? I'm glad we haven't been on the phone so much recently.
Me too. No offense.
Thanks. Do we have a parliamentarian? Richard or Ken? Okay. Moving into our partners, our Adams Cali Shock Trauma, Becky Gilmore.
Good morning, everybody. I did submit my report.
Talk right into the,
Sorry.
You got to be right into the mic.
All right in the mic. Is that better? Okay. I did submit my report online. There were also a couple of paper copies in the back if anybody did not get one of those. Just hitting on some of the highlights over the past 2 quarters. Shock trauma patient visits are up. We have had 3,245 visits, which is 300.
closer to you?
We do it that way. Is that better? All right.
You got to be right into it.
Okay. How's that?
Thank you.
Okay. Sorry. So we are at 3,245 visits so far for the first 2 quarters of FY23, and that is a positive variance of 326 so far this year. For our CCRU patients, those are our critical care patients that are admitted from across the state, we are at 677, which is also a positive variance of 45 from where we were this time last year. So we are getting higher volumes so far this year than we did last fiscal year. Our inter-hospital transfer volumes, they are also up. We have had 835 inter-hospital transfers to shock trauma in the past two quarters, which is 48 above where we were this time last year. We have seen an increase in the amount of these that are coming from our non-trauma centers, which is 84%, so good that we are serving those also. Capacity hours, we have done a lot of work around our capacity hours, and we have had some success in reducing those. For the past month, we were only on capacity one time, and again, we are reviewing every time we go on capacity, and we have a few things in the works to try and help us get those down to zero. For our lost inter-hospital transfer admissions, so far this year, we have lost, I think, 18 less than we did for the previous year. So again, it's something we're working on. Every one of those lost admissions we do review. We're actively working on processes to minimize the amount that we lose so that we can get patients in from all over the state. For our length of stay, again, we've done a lot of work around our length of stay. We have a big discharge by noon initiative running at the minute, and that is seeing some success. Our length of stay is down to 9.03 days, which is down by 0.93 of a day from where we were this time last year. So again, if we concentrate on getting our patients out in a timely manner, that allows us to get more patients in, frees up some of our beds. Our OR volumes have dropped a little bit, and our clinic volumes have also dropped a little bit, but I think we anticipate seeing increases in those later in the year. Our hyperbaric chamber dive hours, we are at 2,092 hours so far for the year, and that's a little down on where we were last year. We have had some issues with chamber operators, and that is something we are rectifying currently. We have several operators in process of training and hope to have them up and running within at least the next month. So those numbers should, again, increase. Shock Trauma Go Team activations. So far this fiscal year, we have had 8 requests, and we have had 2 activations. Requests, 6 of them were for MVCs, 2 with entrapment. The requests have come from Anne Arundel, from Baltimore County, Cecil County, Harford County, Prince George's County, and Queen Anne's County. Of the 2 deployments, one of them was in Baltimore County. That was for an MVC with 2 patients. Those patients both came to shock trauma. And the other one was from an MVC in Anne Arundel County, and that patient also came to shock trauma. For our organ and tissue donation, we are sitting at a rate of 69%. That is a little below where we would like to be. Our goal is 75% on that. We have had a couple of educational events in the past 2 quarters. One was to educate around skin donors, and that was done internally, letting staff know of the benefit of letting patients and families know about skin donation. So 1 skin donor can help up to 5 people, specifically with breast reconstruction. We also participated in the National Donor Sabbath weekend, and that was right before Thanksgiving, and that is where various faith leaders come together with family members and recipients, and it's a participation in a program to educate the public on the need for organ donation. For our global outreach, our trauma observation program, we have had 27 observers so far this year, and again, that is something that is just coming back to us now that we are allowing people to come back into shock trauma as we relax some of the COVID restrictions. From Italy, we've had European visitors from Italy, Sweden, and Switzerland. We've had a visitor from Asia, from India, 4 from Israel, and then 18 from the United States. They were observing with nursing, the trauma teams, orthopedics, and plastics. Again, we anticipate seeing an increase in the amount of observers that we have coming through now. Our Center for Injury Prevention and Policy, again, we are ramping up things now that we are able to go out in person and attend events. We have a total of 45 events so far in FY23 with 3,286 attendees. Trauma Prevention Outreach has had 2 events with 320 attendees. Our Trauma Prevention Program for Teens has had 4 events with 34 attendees. Adult programs, 6 events with 203 attendees. And then Stop the Bleed campaign is again something that we are really concentrating on at the minute. We have 23 events with 1,688 attendees. This includes events for Baltimore County Public Safety Day and for Baltimore County Public Schools, where we trained all of the school nurses in Stop the Bleed skills. Our Minds of the Future, which is our young people's event, we had 10 events with 1,041 attendees. And our violence intervention program has had 145 interactions. Again, this is an area that we are concentrating on, with especially the amount of violence we're seeing at present. So all patients that are admitted with a primary encounter for a gunshot wound, or assault, or stabbing are offered de-escalation intervention counseling and referrals to community services and up to 30 days on community case management. For our EMS outreach and education activities, pre-hospital education activity, we've had observation programs for our EMS students. 27 providers have rotated through the trauma resuscitation unit and the ICU so far this month, and we anticipate more coming through. For training, we've had pre-hospital trauma life support, 2 courses for 12 EMS providers. High fidelity simulation for EMS professionals via Zoom. That was an event that was undertaken for providers in Ukraine to learn how to train their EMS providers via our simulation lab. And that was for 100 providers within Ukraine. ALS skills review, 1 course for 6 Harford County paramedics, and Maryland Express Care and the GO team training, 2 courses with 11 EMS and 2 anesthesia providers. We also attended a first aid rally for the Boy Scouts back in October. That was 70 scouts and 30 scout leaders from Baltimore County. Again, that included Stop the Bleed training in that. And we also did Stop the Bleed training for wilderness colleagues at MSAR back in October, 16 members and 5 family members. Also on Sunday, January the 8th, we were able to host the MSFA Safety Committee meeting at Shock Trauma. I think that went very well. We provided a tour, and I think the day was enjoyed. And that's the end of my report. I have any questions?
Any questions for shock trauma? Thank you.
Thank you very much.
State Fire Marshal's Office, Fire Marshal Geraci.
Good morning. Hope everybody's well. So, start off with fire fatalities. In 2022, currently we have 64 confirmed fatalities for 22, and then there's still 8 deaths pending with the medical examiner. So far, we're not off to a good start this year. We already have a total of 5 confirmed fatalities with 8 pending at the medical examiner's office for this year. Clearly, we continue to have a fire problem here in Maryland, and really we need to get all the departments on board to get out into their communities and start talking to these folks and making sure we got working smoke alarms and escape plans in these homes. I mean, if you think about it, I mean, today you have the least amount of time to escape your house than any other time in history. Think about that. The least amount of time now than any other time in history. You don't have much time anymore. So we got to get that message out, and we just got to do a little better job than what we do. We're doing a great job, but we need to do better. So, Senior Deputy State Fire Marshal Chris Dyberlin has retired from the agency. She had over 15 years of service. She worked in our Western Region and Headquarters office, and we wish her all the best in her retirement. You just saw yesterday we gave out all the new, the investigators all have brand new equipment that we gave out. We put that out on social media to everybody if you saw that. So everybody's got new tools and lights and everything like that. With regard to residential sprinklers, in a recent report from the National Fire Sprinkler Association, since the first adoption of sprinkler requirements for residential occupancies in the state and our continued efforts in this area, fire deaths have been reduced by 52%. So obviously the sprinklers are working. We're saving lives with sprinklers and 10-year steel battery smoke alarms. But obviously we're still losing folks throughout the state that we don't need to lose. I won't go a lot into Annapolis. We're working with the legislative committee. I appreciate the opportunity to be at the reception with you all in Annapolis last month. And we are continuing to work with Chief Phillips and everybody down there, and getting bills passed and getting bills killed, as we did yesterday. So we got a few of them that are going to get whacked, so that's good. We participated in Community Risk Reduction Week, which was January 16th through the 22nd. Teresa put out a lot of information on that that cover the 5 R's of the CER program. Just some numbers for us. During the fourth quarter, we had a total of 202 investigations. 152 were fire-related, 20 explosive, and 22 investigations. 9 criminal cases closed by arrest, with a total of 10 individuals being arrested. 2,400 and some inspections, and about 250 plans reviewed. For calendar year 22, the office investigated 799 incidents. 598 of those were fire-related, 135 were explosive, 66 others. 40 criminal cases were closed by arrest, with a total of 68 individuals being arrested. 27 incendiary cases were closed, which resulted in a 25% closure rate, which continues to be well above the national average. The agency had a total of 152 criminal cases, of which 40 cases were closed by arrest, resulting in a 26% closure rate. 10,839 inspections were performed last year. We took in 1,845 plans were received, and we reviewed 1,484. Hopefully you got asked the Chief Phillips to pass this out. Overdue Empress reports. Hopefully you got a copy of that. There's some handouts in the back. We're still missing a few folks from Dorchester, Garrett, Queen Anne, Somerset, Talbot, and Wacomico counties. If you could talk to those folks and try to help us get those reports in, so we can try to have a decent report for you all in June at convention, to let you know what the fires are going on here in the state of Maryland. So we need everybody to report in, and it doesn't really matter if we don't have all the correct data and the proper data. It doesn't, as you well know, it doesn't work. So other than that, we had a promotional exam this month, the last couple weeks. We're getting ready to promote 2 deputy chiefs in the office, so be able to report back in April on those. And we're going to get ready after that to hire about 3 or 4 new folks, so looking forward to that as well. So haven't had our budget hearing yet with MSP. We did ask for 10 new fire inspectors. They cut us back to 5, which is what we expected. But Steve, MSP has assured me the 5 other pins if I can get the people to apply for the positions, which we usually don't have a problem for people applying for those positions. So hopefully come July, we'll be able to get 10 new inspectors on board and get them out and really start hitting the existing structures that we don't really have an opportunity to do. So we're looking forward to that as well. So a lot of things happening, and keep you up to date. So that's all I have. Thanks.
Any questions for the Fire Marshal? Thank you. Mark, for the Commission. Commissioner Bilger.
Thank you, Chairman Cox. I would like to take an opportunity to recognize Commissioner Doug Alexander, Commissioner Dan Stevens, Commissioner Mike Faust, who I'm honored to share a position of Fire Prevention Commissioner with. I'd like to bring you up to date. We are still waiting for the proposed changes to the State Fire Prevention Code to be published and adopted. We were told that Maryland State Police were going to submit emergency legislation regarding this matter, and as of Friday it has not occurred, which means that we will not be able to produce the the MSFA's fire laws book until such time as this document has been approved and adopted. Thank you very much.
Any questions for the State Fire Prevention? Thanks, Mark. Maryland Aviation Command, First Sergeant Sykes. I hope I pronounced it right.
Good morning. My name is Dave Savitas, First Sergeant, representing the Aviation Command and presenting the report for Major Tagliaferri and Captain DeCourcy. I assume the captain forwarded the minutes for the notes to the chair. At least I got an email saying it. If not, I'll give you what I have.
They're on.
Okay, very good. Some of the updates. We had 5 trooper medics start their command rescue tech training in January. Expected to start field training in March and anticipated deployment by late May or June. We have 3 trooper medics assigned to FOB. They're ongoing field training right now from the recent class of 154 and 155. They're expected to be transferred to the command sometime in June. We do have 1 trooper and 2 MSP medics reported for active duty with the Maryland National Guard, and that's for a year-long deployment. I believe the ceremony was held with the governor earlier this week on Monday. MSP has hired a ground service equipment technician and a maintenance tech. Both of them start February 8th of 2023. And we also hired a procurement officer manager to assist with the procurement process in the command. Currently, MSP has 16 helicopter line pilot vacancies. We have 1 pilot, 1A, in the background stage of the hiring process, and 7 pilot applicants pending interviews and background checks. We have 1 external pilot, 2 in the final stages of the hiring process. MSP has 2 pilots finishing their upgrade promotion. Actually, email came out just yesterday. They internally completed their upgrade training to pilot 2. And we're continuing our diligent efforts to recruit pilots, maintenance techs, and all potential trooper applicants for the class scheduled for September. Some of the maintenance updates: 383 is currently undergoing its 1-year, 300-hour heavy inspection at the headquarters at Martin State. 389, which is slated, is currently undergoing their 1-year, 300-hour inspection at Augusta in Philadelphia. That's due to return sometime this month. 382s, which is currently at the headquarters at Martin. It's designated an airworthy asset for the last 2 or 3 weeks. Our maintenance staff has done a wonderful job of keeping a spare available for pilot training, medic training, and the governor transfers if we have to do something like that. All the remaining 139s are in service at the 7 sections across the state. Some ongoing projects: the whole blood program is progressing well. Protocols are in place, MOU's been signed, and equipment's been procured. Currently, we have everything we need except for the blood. We do have a scheduled meeting with the blood bank at the end of this month, and hopefully, knock on wood, we'd be actually carrying it in the first 2 sections, 1 and 3, by March, the first week in March, pending all the policies are approved within the MSP. Hoist platform, that the shell has been completed. They're working with Goodrich to obtain a hoist pod, which would emulate what we currently carry in the 139. This platform will be used by trooper medics conducting hoist training evolutions while on the land, and improve proficiency and reduce training and flight time on aircraft. Radio mapping systems, MSP is working with Electronic Services Division and contacting various vendors to pursue the upgrades that we have required on our aircraft, and also upgrades on the mapping systems for our FLIR and tracking stuff. And then MSP implemented the in-house AW139 type rating course. This course saved an estimate of $60,000 per pilot to upgrade to second in command for the command. The FAA did a review, determined that our pilot training section classroom, the flight training device, and all in-aircraft training was equivalent to outsourcing type rating. So this program has graduated, like as I said, 2 recent pilots and upgraded them. So that's a significant savings for the command in the state. I'm not going to break down the mission to date stuff, you've seen that, but from 2023, just to highlight total missions, 179 with the flight hours of 142.1. Some notable events that occurred MSP attended the legislative reception with the MSFA in Annapolis. That was on January 24th. MSPs conducted 7 IFR instrument flight rated medevacs since implementing the command's updated policy in late December. Case in point, January 19th mission by Trooper 4 for a critically trauma patient from Ocean City to shock trauma during deteriorating weather conditions was highlighted in the Ocean City Department press release. MSPs compiled the following data for review of the 2022 activities. Responded to 1,803 sane medevacs and transporting 1,861 patients. Handled 157 law enforcement, assisting with the arrest of 45 suspects. Flew 162 search and rescue missions, locating 75 victims, and complete 8 hoist and aerial operations, rescuing 8 victims throughout the state. Logged 2,294 flight hours in support of the aviation's mission. Conducted more than 163 hours of intense training in the flight training device, and coordinated nearly 600 hours of quarterly medical education training, skills evaluation, and hoist training. In addition, the 7 sections themselves completed more than 710 hours of in-aircraft mission training for their crews. Our system remains intact, ready to respond throughout the flight operations oversight and the management of SysCom and the Operations Control Center to provide the most appropriate asset to serve and lead our partners. Sir, do you have any questions for the command?
Any questions? Sergeant, I have one.
Yes, sir.
Well, first of all, a comment. The 2022 activities really show that the command is very, very active in both law enforcement and mainly supporting the emergency services, fire service, and we certainly appreciate that.
Thank you.
And I know my company has received a lot of support from the Aviation Command. My question is, with 16 pilots, and I apologize, you may not be able to answer this, but with 16 pilots, is there a potential of any aircraft being out of service? And the reason I ask this, a couple years ago, MSFA found out late in the game that different areas were closed, and I'm not speaking for the president, but we would certainly like to be a part of that ahead of time.
Yeah, absolutely. And I believe you're referencing Easton and Cumberland, where they closed pretty much most of their operations. I can tell you that there are temporary closures for a 12-hour period just for staffing issues, but we ensure that no neighboring sections, 1 or 2, if say Andrews or 7, if there's going to be a lack of staffing, 1 of the 2 will be covering that response area. We have no plans for extended out-of-service times, especially in the Easton Cumberland issues that we've had in the past. And with the heavy recruitment that we've been going on, we're hoping within the next month or so we'll have 5 additional pilots. The IP, the instructor pilots, we have 8 of those, and there's quite often, and myself, assigned to Martin, we do a lot of backfilling for the sections themselves, and there's a lot of organization. Deputy of Flight Operations, Mr. Hawkins, with the first sergeants, work on spreading the people out wherever they might be needed, but there's no plan in place for extended out-of-service time. We're still reaping issues at Cumberland. Some providers, they're doing an extensive, great outreach out there in Cumberland, but they're still, oh, you guys are out of service at night, which is totally untrue. They're 24 hours. The mission and goal is 24 hours across all 7 bases. There may be a temporary day where they're out of service, but we have position or aircraft in place to cover both of those areas. So anything that's, I do know that if there's any future plans, which I'm not aware of, and that's the command staff behind closed doors, thank goodness, I'll stay there. There's no talk or discussion for anything like that.
Appreciate that,
Yes,
and really appreciate that explanation, because that will help us dispel rumors.
Yes.
That we do identify that the command is working and doing backfilling and all.
And I also know with the new governor in place, his chief of staff is directly working with our pilot union to address pilot pay issues, which is excellent thing we have to do for recruitment. Historically, usually the lower lieutenants and the governor's staff will handle that kind of stuff, but we have the man in charge of the governor's movements handling personally direct with the pilot. So hopefully we'll see some positive outcome before April with that. So,
Thank you.
Thank
Any
you.
other questions? Thank you.
Thank you, sir.
MIMS, Dr. Chismar.
As you all know, I don't need the microphone, probably. Good morning, everyone. It's a pleasure to be here with you. I bring greetings on behalf of Chairman Clay Stamp, Dr. Delbridge, the Maryland EMS Board, and MIMS. And I want to start just by highlighting, as I just attended a national meeting, we have an extremely strong EMS system, as you all know, in Maryland. I'm very fortunate to work with President Kurtz, Vice President Smothers, who is also the chairman of our SEMSAC, Ms. Dusa, Mark Bilger, and the EMS committee. And all put together, we represent a system, all of us in this room, that transports 546,000 patients per year, 546,000, with 1.2 million patient contacts, patient reports, and eMeds. Over 20,000 EMS clinicians. So despite our efforts with recruitment and retention, 20,000 EMS clinicians statewide. We run about 10,000 patients to the hospital per week. So just letting that sink in, I think, is very powerful. And one of the things that enables us to be so strong, that I'm always very proud to talk about at the national meetings, is the Maryland EMS Operations Fund, or MSOF. The MSOF was put into play long before my time in EMS, and about every 10 years it requires a bit of a refresh. Currently, the MSOF is funded through $29 surcharge on motor vehicle registration, as well as a $7.50 surcharge on moving violations. And about every 10 years, we as all the partners need to sort of seek help and to go back to the legislature to address solvency. So Dr. Delbridge asked me to mention that at some point in fiscal 25, it's projected that the current MSOF will become insolvent. That's not a surprise, as I just mentioned. The last time we went and revised that was around 2013. And with COVID and motor vehicle registrations being put on pause, as well as the MSOF not being indexed to inflation, I think it's probably no surprise that we were going to need to address solvency at some point in time. But I wanted to at least open this issue for the executive committee. I know that Dr. Delbridge has been meeting with President Kurtz and the leadership, and I want to highlight that this is probably one of the most important things we do. I'm not aware of any other state that takes a statewide approach to education through MIFRE, to statewide protocols, an electronic health record, and a medevac system that is all statewide and evenly distributed throughout the state to the greatest degree that we're able to do that. So I wanted to just first mention that the MSOF will be an issue where I think this year we should focus on educating our legislators on the importance of the MSOF, and feel free to use any of those stats or other stats to help them do that. That we are a standout in Maryland, and when I talk about the MSOF with other states, they're just absolutely amazed that we're able to pull that off. So I'll digress from that topic. Switching to another topic, it's my pleasure to report that our conferences, all three big conferences, are back in person. We just held Winterfest in Easton. The Milton Berger Conference will be going on next month in Western Maryland, and we'll be holding our EMS Care annual conference in Ocean City at the end of April. So we look forward to that. We look forward to good registration and getting everybody back to the table in person. I know I share that sentiment with Chairman Smothers. We've talked about how we can get that back online. The next issue I'll address with you, the protocol updates will be headed your way for July 1st implementation, as in years past. I'm pleased to report that there will be no new asks as far as equipment or supplies. We're not adding new medications or new protocols that require the purchase of new equipment. So I'm always very happy to work with the EMS committee of the MSFA and Mr. Simpson to make sure that the volunteer ambulance inspection program is up to date. We will hold a meeting in probably March just to make sure there are not any concerns, but we don't anticipate needing to add anything to that inspection process for this year. And the last thing I'll mention is the hospital offload work group progress. As I mentioned to you, we transport over 10,000 patients per week. Our median time statewide is right around 20 minutes, our median EMS transfer of care time. That's measured from the time we mark arrived at the hospital to the time we physically hand off care to the nurse or the physician. So 20 minutes median and around 45 to 50 minutes 90th percentile. And what that means is that 90% of our patients are transferred within that interval, within that 50-minute interval. There are some hospitals that do this extremely well. Those medians of 20, the median of 20 and the 90th percentile of 50 is a statewide average. There are some that can do it in as few as 9 minutes median and 30 minutes 90th percentile. So Dr. Delbridge and I have worked with hospitals to bring them together so that we can get some of those hospitals that are able to do this very efficiently partnered with hospitals that are not doing this efficiently. In a worst case scenario, we have hospitals with median times in the 30s and 90th percentile times over 100 minutes. So clearly there's a lot of variability. Some of this is due to staffing, some of it is due to physical space, but clearly we're committed to making sure that we improve upon that problem. We know, and we shared this statistic recently, that just for instance in the city of Baltimore, that the impact of EMS transfer of care is essentially 6 ambulances 24/7. So if you think about that, 6 ambulances, the city would need 6 fewer ambulances 24/7 if the EMS offload times were reduced to 30 minutes or less. That's a tremendous impact, and again, we could share anecdotes from other counties where that would also have a tremendous impact. But I wanted to highlight that some hospitals are doing it well, some hospitals are not doing it so well. What's being dubbed forced offload policy that started in Queen Anne's County and the Mid-Shore and is migrated over to Anne Arundel County is migrating throughout other counties. And some of those counties are taking this up in an effort to really spur discussion, and it's done that. It's really put this issue front and center for all of the hospitals and their leadership, as well as the Health Services Cost Review Commission, as an item that is of significance, an item of the highest importance. So with regard to hospital offload, our next step is bringing the hospitals and EMS together. We have had the hospitals together to say, this is what we expect of ourselves, and now going back to EMS and saying, working together jointly to make sure that the expectations are clear, and clearly there are going to be times when the hospital is not able to offload or transfer care within 30 minutes. We understand that, but what we're asking of the hospitals is that they provide an escalation policy or a way for us to say, look, this is not meeting expectation and we need the leadership of the hospital involved, not retroactively or retrospectively, but in close to real time. So, Mr. Chairman, that's my report, and I'm happy to take any questions you might have.
Any questions for Dr. Chismar? Mr. President.
Tim, I just want to say thank you on behalf of the leadership and to relay to Dr. Dilbridge when meeting with us on the concerns that we had. Thank you.
Thank you, Mr. President. And I didn't mention, I was remiss a little bit, that we did meet with the leadership as well regarding EMT testing, the psychomotor component of EMT testing. So that has not had a refresh since I've been at MIMS. The scenarios, none of that. So we are looking at refreshing that. We're looking at, again, the scheduling process for EMT psychomotor testing. And President Kurtz and Vice President Smothers, and as well as Chairman of the Executive Board, we're really happy that you spent some time to meet with us on that. So we're going to, again, continue to keep the MSFA as well as MIFRI involved as we move that forward.
That's going to be reported on more I know the leadership heard about it, but everybody in the audience, maybe at the next executive committee meeting?
Yes. I mean, as we heard, we're working through that process, and we want to work through it both with MIFRI and MSFA. We met with MSFA first, but we and I was just talking to Director Cox, the other Mr. Cox, behind me about our plans moving forward, and we need to make sure.
You were going to say the one with hair, but go ahead.
We need to make sure that all the partners are involved in that process moving forward. So there's not an announcement or a plan or anything like that because we're still working through it.
Okay. Any other questions? Thank you.
Thank you.
Director Cox, Mifrey? The one with hair?
Going away fast. I didn't say it.
I don't know. It's getting thin up there since the other Cox has been with him.
Thank you, Mr. Chairman. Okay, I'll leave the MSOF stuff alone. Dr. Chusmar did a wonderful job explaining that, so no need for me to go into that. I did want to make mention that just the other day, anybody attending the University of Maryland campuses no longer have to have proof of COVID vaccinations, thank goodness. Didn't really matter for the regional facilities because they go by local health department guidance and metro academies, you know, the AHJ rules we follow there, but in College Park that was really somewhat of a pain. People not coming through there, and they hit the Wi-Fi on the phone. If they don't have a vaccination status for them, they would get flagged, and it's quite the argument we have with them all the time. So anyway, that's all over and done with. Our stats since the beginning of the fiscal year, about 383 classes delivered to date, 13,000 instructional hours, 16,500 student hours. It's about 5,160 students have attended classes. It's been 349 withdrawals and 4,623 students who have passed whatever program of instruction that they were in. So fairly busy, but I think the numbers are a little slower for that since the fiscal year started. It will pick up a little bit as we head into the spring and summer. EMTB programs. Last year, I just wanted to mention that we did finish out with a 73% pass rate first attempt and an 83% pass rate after the second attempt. So far above the national average and better than the other state averages that we have. So far for this year, there's only been 2 EMT classes that have tested, and first attempt was a 73% pass rate, and they haven't, nobody from either one of those classes has retested yet at National Registry. So on par to remain the same, if not a little better in the coming year. So our tablet testing and test item analysis program is still ongoing and rolling out. We are continuing to add new classes. They are revised and put out there. There's been a couple of hiccups along the way. Those hiccups, once we've looked into them, really come to do with the bandwidth of the Wi-Fi and the facilities that we're using them. So we've been telling folks to make sure that they can support about 60 devices on the Wi-Fi and the systems of the fire stations if they want to be able to take tests there at those facilities. So we'll send people out to test that and check with them. We've sent our IT folks out to many of the places, and this just isn't in the fire stations. We've had issues with some of the metro academies also, but they've been able to get much of that safe and fixed. So our policies and procedures are still under review and being changed. There's a whole bunch listed in the report that I filed electronically of the new courses that are being revised, what's in pilot, and so forth. I'm not going to go through each and every one of them for you all. I do want to bring to your attention, and for some reason lately in the past year, I've had a lot of requests of people who take the EMT programs and they take the National Registry test. And as you well know, in the state of Maryland, not required to keep it. However, some folks want to keep it and have approached us and asked us about a refresher program for National Registry. So I've had our folks in the planning section look into this, and as you well know, Maryland requires 24 hours of refresher every 3 years. National Registry requires 40 hours every other year, or every 2 years. So we did look into it. We actually have classes that will fulfill the National Registry requirement. So in the very near future, once Diane and our folks in planning get it ironed out, there will be an online NREMT refresher program. And that'll consist of the 24 hours they take for Maryland, and then there'll be an extra 16 hours they can take all online if they want to keep that. So I don't know why the folks want to keep it when they're not required to in the state of Maryland. The only thing I can think of is I believe some folks in the federal departments are required to have national registry. So, but I couldn't tell you that everyone that have asked us that are from there. But anyway, it'll be out, it'll be available to the folks, and again, it's up to them. There's no requirement for the state to do that. So, the instructor certification issue that we've talked about in the past and been working with MIFRE Tech and the Maryland Higher Education Commission is about coming to a close. As you know, there were some standard changes. We separated the Instructor 2 and the Instructor 3. You know, in the past, we were lucky in the state of Maryland. The current Instructor 2 program we had got them Instructor 3 certification also. However, with the latest standard changes from NFPA, we felt that it would be too much, that Instructor 3 is more of a managing, as I said at some of the other executive committee meetings, more of a managing training officer type of certification, so someone that runs a training academy, a regional training facility, or so forth. We did send Miss May, and she graciously went for us. We have delivered the class one time so far. It was delivered out at a military base in Idaho. She come back with some great feedback, and one of which was that she will never, or we will never offer an Instructor 3 course 5 days in a row again. It's just not going to happen, even though it's an 18-hour program. It's not going to happen. The workload on the instructor and the students to do the practical skills and assignments that they have to do can't be done in that short a period of time. So that class you'll probably see run 1 day a week, so it gives the student and the instructor ample time to, one, the students complete the assignments, and two, the instructors have time to really go through and give a good check of the assignments. So the hours for Instructor 2 are not going to change. That can still run in a 2 5-day class period. And then any of the Instructor 3 classes that we will move forward with will probably be offered in 1, maybe 2 days a week, but not in a 5-day-a-week format. The next schedule for that class to run is going to be in Howard County, and I believe it starts the end of this month or the beginning of March. So, and we'll keep a close eye on that. And one of the gentlemen is teaching the class is part of MIFRE Tech, so we'll get some great feedback from them, and he's well versed in the issue that we had with that. As far as the change, as I mentioned in the last meeting, after we got approval from MIFRE Tech, that went to the Higher Education Commission. They approved it, and then that went out for public comment. That public comment period, as of the last meeting we had, I believe on January 24th for MIFRE Tech, that public comment period was coming to an end then. It was going to take them about a month for the AAG from Higher Education Commission to go over that stuff, get the final language fixed up if it needed to be fixed up, and then we would go ahead and reprint all the orange books or the COMAR regulation for the instructors and get that out to everyone. So, ATRA site visits probably doesn't affect you all so much as it does the metro academies, but where the ATRA sites are. We have a National Pro Board visit that is going to be in August or September of 23. Pro Board had moved that back on us. It was supposed to be scheduled for the spring, summer of this year. And then an IFSAC visit. Never before have we had both of them at one time. I kind of like both of them coming at one time. It gets it all out the way. So, and then we don't have to worry about it again for 5 years. But with that visit, there will be 2 visits to 2 separate regional ATRAs across the state. So they pick them, we don't, so we don't know where we will go out for visits, but and they'll be given a little time. Our folks have already been working with the local training academies to go out and make sure all their stuff is in order long before these folks get there. So, next PDI for instructors is going to be on Saturday, April 29th. That's going to be in College Park. It's going to be an EMS fire and rescue skills program that's going to be delivered. So there's nothing for the management instructors or hazmat instructors, but EMS fire rescue skills, and professional development will be based on skills evaluation and skills of the students. So it'll be a lot of hands-on. They won't be sitting in the classroom, but just something new that we wanted to try to make sure everybody was up to par and on the same page with the skills evaluations that we're doing. So Pearson View testing centers, they're continue to be in operation. 2,700 tests since the inception a few years ago when we decided to keep all the EMT students together and make that testing part of the class again. And as I said in previous meetings, I am absolutely positive when we look at the numbers that has a lot to do with the increase in the successfulness of the student and the folks taking the test. If you all will remember, back then, these kids were taking the EMT class, passing it, but never going and registering to go take the National Registry exam because they were competing with electricians and steam fitters and beauticians and barbers and everything else in these strip malls. So that was, I think, one of the best things we could have done for the program. So they're there, and then the other test center will reopen up in Western Maryland as soon as that project is done. That capital project is about coming to an end, so we have killed the lease with Frostburg University for the space we were using for the Western Maryland folks, and I believe sometime in April or May we'll start moving back into the new facility, and it should by July 1 is our goal to have that place fully functional and operational again. So nobody will have to travel from Western Maryland down to Hagerstown to do any of the live burns or anything. All right. Instructor skills, just want to remind everybody that we are doing local deliveries for that. If you have folks that want to be instructors, let us know. We will send the folks out to the local departments, and we can do the skills right then and there. Anybody needing to be an instructor only has to be 21 years of age, have 3 years of experience in the field that they want to teach, and they just have to be in good standing with your department or their sponsoring agency. So. The Maryland Instructor Certification Review Board, last meeting for that was on July 18th. I do have the meeting minutes, but I did not have the latest stats, so I left the fourth quarter numbers in the report that there is there electronically. So MIFRE's applied for another $500,000 grant through the AFG. Hopefully we'll know something about that in about 6 months, and that grant is focused on equipment and a lot of new props that are out there. In conjunction with AMEMA, and I think the Secretary has slipped out, but and especially Secretary Strickland, we at MIFRE, starting back on January 3rd, have begun housing the incident management team manager for the state. So they'll be coming out of MIFRE. That's where their office space, their vehicle, and all that will be. And since they are so training focused, it was, I really believe, the right thing to do. And we'll be able to work closely with them, and they'll still be able to work closely with MDEM and the local EOCs to prepare and stand up the team that used to be the Baltimore Regional Incident Management Team that they've made into a state team a while back ago. So MIFRE's budget hearings are February 22nd and 23rd, both in the House and the Senate. Quick thank you to MSFA for the reception. I've said this at some other meetings. I think it was one of the best receptions I've ever been to. It was very well attended by the elected officials, and a lot of face time for all of us partners with many of the elected officials. I don't know if it was the venue or or they had nothing to do that night, but I think there was more people showed up that I have seen in the past few years for this last reception than they have when we had it, or you all were hosting it in the actual Senate building. So I don't know what the difference was, but it was great. So, and with that, I'll address any questions anybody has.
Come on up. Any questions from the executive committee? Okay, if you'll go to a mic and state your name, please.
Michael. First of all, thank you for everything y'all done. Thank you for upgrading Southern Maryland with all the computers, everything, and the National Registry computer. Even if I had a little bad taste with National Registry, but thank you. I know it's a long time coming because I've been taking class since 2006, so I can kind of count for the old days with paper and pens and all that stuff. My big question is to you. So with people with, I do have a disability myself, with reading. Every 3 years, I get tired of this. I do have an IEP through high school. I turn documents in official documents and turn in everything done. Every 3 years, I have to physically go to my doctor and get an update doctor note just saying I need a reader. This is not going to change. Tomorrow, I'm not going to wake up and read this whole essay. And tomorrow, next day, I'm not going to read the essay again because of my accident. Is any way y'all can figure something out about this, because it's getting, if I taking class, like I'm going to take a class on the 15th for air truck, now I have to go get a letter again because I haven't took a class in 3 years with y'all. Now I have to resubmit this again, get it up to College Park, and hoping y'all approve this by the time the test date, and hoping y'all not back up there and get this going, and then when the next time to go and take a test again. It's not just only me, it's a bunch of other kids too.
Right.
Some people do have document and physical document signed by professional people. Is any way the next meeting y'all have can look into any official document, IEPs or anything like that, can count for future reference or anything like that?
Yes, I feel your pain because it is difficult for us to keep sending things back and forth also to the university. Unfortunately, the university is the policies that we have to follow, and that's their policy. So we fight that each and every day, and it's really difficult sometimes for not even adults, but for the high school kids that are there. Same thing, we have to send them back to the doctor. So we have ongoing discussions with them about that now. I don't know why they don't extend the period, longer. I don't know, but I know Miss Audrey Williams, who is our equity administrator, she is in the process, because it takes up a lot of her time chasing folks down and having to send them back only to have the same information come back, just with a new date on it. So, especially in a case where, as you're still talking about, there's going to be no new testing or anything of that sort. So, I will work on it and then get back with you directly on how that works out.
Okay, now also, this is part 2 with this question. And this is why I got a little bad taste with National Registry. 2 years ago, I passed Marion EMT with Mifree.
Okay.
After 8 tries, and finally I passed it with the one instructor you got at Mifree right now. Thank God for him. He a well and good instructor. Pass it and turn my document in to National Registry to get a reader. They did not recognize it because 2015 documents. I even turned out a little letter saying update doctor note. They're still playing the game, is not recognized. It's anyway because y'all have peer review now. It's anyway y'all can interfere now with bonding together because y'all abide by the same rules and say, hey, wait a minute, we apply a reader, he need a reader too. So that way we don't have to fight with National Registry. Y'all all follow under the same rules.
Right. I believe that it hasn't been too long ago that we went to National Registry and fought with them over that, and we ourselves lost. National Registry would not recognize someone having a reader for their test. So we will certainly go back and check again for you to see if something there has changed. But I think that's a discussion, that I'm going to need to have with the folks at MIMS, who they can have with the folks at National Registry to see if, since things are done differently in our state. Unfortunately, National Registries are, a third-party, independent organization, and they make the rules from themselves.
Right. But if you look up on National Registry website, they got the same exact rules MIFRE had on their rules, and the Registry of Merit. So somebody not playing the rules right.
Right.
So if somebody know how to read and show them that, but if your team can look into that, that'd
Sure.
be great. Thank you.
Not a problem. Thank you.
Any other questions for MIFRE Director Cox? Thank you.
Okay. Thank you, Mr. Chairman.
MDIM, Terry Thompson.
Good morning, everyone.
Good morning.
Our report was sent in. Was posted. I'm not going to read it over again. You all
move a little closer to the mic.
You all can see the report and read it. These are a couple highlights since the last executive board meeting, the top one being that Secretary Strickland was appointed by the incoming governor as our secretary, which was great news. We're still working with the Food Resilience Council, which is under MDIM, meeting with different groups in the agriculture leaders in reference to this. So that's an ongoing thing and will continue. We helped and assisted and worked with other state agencies to include the Maryland Military Department with the incoming governor's inauguration. As you can see, we're doing disaster risk reduction program in the high schools now in Baltimore City that they requested because they have a course running in emergency management. The only other thing I want to point out is the hazard mitigation. The Resilient Revolving Fund is there that'll provide money to local governments to pay for hazard mitigation projects. It's now open. That program's going to be administered by MDIM, and the fund's going to has to be created. Well, it was created because of the legislation. So the governor will have to put money into that fund and let's see. And the other thing is I want to bring up for your attention is public assistance. We're still busy processing cost and reimbursements from 5 different presidential disaster declarations. Of course, the largest one is the COVID. FEMA has $1.44 billion in public health emergencies in Maryland, so we've been very much a part of that, trying to work with them on that. And couple of other events, just slightly more than 25 million was reimbursed for the 2 floods in Howard County and Ellicott City. Both of them combined is 25 billion, and then there was 12 million that was obligated to pay for some cost here in Calvert County, Dorchester, and St. Mary's, and that was associated with the tropical storm in 2020. That's pretty well it. I think Secretary Strickland covered everything else. I'm available. Just pick up the phone and call me. If I don't have the answer, I'll get you the answer, or at least I'll attempt. And the Secretary Strickland said the governor was out west. He was at Deep Creek, I think it was Monday, in Lonaconee. And for the situation at Lonaconee was their water, they had a bad situation with the water. So they had to turn the water off. And it wasn't no fault of their own. It was the company, I believe, Timmy knows probably more, that let's just put it, that's where it's at. So Lonaconee helped distribute water. So he wanted to stop there and recognize them. And that's it, unless there's questions.
Any questions for MDEM? Thank you. Oh, go ahead, buddy. $54. Thank you. Thank you.
As long as I can do it, I'm going to do it.
DNR Forestry, I didn't see anyone. No, okay. Maryland Fire Chiefs, President Lynott. How about Vice President? Anything from Maryland Fire Chiefs?
Well, I guess if the president's not here, I will attempt to set in for him. Bob Phillips here, first vice president of the MS Maryland Fire Chiefs. No, I don't have the president's report. Matter of fact, I was checking to see if he had forwarded something to me. And I don't know if Vice President Delina is here.
I don't see him. I don't see John. I don't see Timmy now. He could talk about the... Timmy, can you talk about the Maryland Fire Chief Seminar? Because it's coming up really quick.
And other than that, we'll have our annual meeting coming up in April, I believe is the date right this minute. I have to look back at the calendar, where we have our elections and installation of officers and things like that, an awards banquet.
Thank you, Mr. Chairman. For those that are not aware, March 4th and 5th, the Maryland Fire Chiefs will be having the John W. Hoagland Maryland Officer Seminar, University of Maryland, Shady Grove. For those that live 50 miles or further away, you can get a hotel and be reimbursed. Teresa will be happy to take care of that for us. But we had the Clarion Marriott Hotel in Gaithersburg. A block of room has been reserved. We've got a good list of speakers that are going to be working for us those 2 days, and we had a very short turnaround on trying to get things put together, but with the cooperation of our partners at MIFRI, we were able to get everything put together on the registration site. So go to MIFRI Seminars, and you can register for that 2-day program. Like I said, we have a very good program coming up, and I don't think anybody will be disappointed. Any questions for me, please?
Any questions for Maryland Fire Chiefs? Thank you.
Thank you.
Finance team. Treasurer Ron Sarnicki, Financial Secretary Mitch Vogt, Vice Chairman of Budget Gene Kerfman,
Good morning. Hopefully, all of you have received 3 reports on the financial status of the Maryland State Firemen Association. You should have received a profit and loss, balance sheet, and a budget versus actual. They were submitted last week. Any questions on numbers? Good. Awesome. So the biggest piece for this time of year is trying to get all of our recording and reporting with the Internal Revenue Service. So all of the 1099s, NECs, Ms, and Rs have been completed, along with the W2Gs. All of those have been mailed out to each of the recipients, and a master filing has been placed with the Internal Revenue Service. We're currently working with Ficon and Associates on our financial review. That will include a financial report to be provided to the Executive Committee in June at the beginning of the convention, and highlighting all of the fiscal activities for the last 12 months. We are looking at or anticipating for next year the governor's budget proposal. I do have to say that we received a little bit of a surprise this year in a positive note. When we got the direct deposit from MDEM, it was for $1.225 million, and we were anticipating to be at $1.025 million. That we received an additional $200,000, and that was put in with the appropriations fund, and Gene's going to cover that in a little bit more. But we did confirm with MDEM that that was correct, and that allotment to the MSFA, and so that allowed for an additional funding in the appropriations area. We are working with the trustees on the verification of all of the relief fund recipients. Letters were sent to each one of the recipients to receive money through the Widows and Orphans Fund, verifying their next of kin, beneficiaries, if they have someone that's handling power of attorney, and where their deposits are being made. We have completed the Maryland sales tax exemption renewal, so we have our certificates. If any of the organizational members need a copy of our tax exempt certificate for the state of Maryland for sales tax, I have those, and we have them over at the finance table. So let us know and we'll get you a copy of that. We've completed our Maryland charity registration with the Secretary of State's office. That's all been filed electronically, and received confirmation they've received our renewal application. As far as the SAFER grant goes, on the financial side, we did have all of the contractors hired, but now we understand that we're going to have one that's going to need to be replaced. We've established a payroll system to ensure that direct deposits are made for each of those contractors. And all of the budget items related to SAFER are loaded into QuickBooks. So the budget document that you received this week includes the funding recommendations per year provided through the SAFER grant. There will be a recommendation from the Budget Committee on appropriations as far as an action item, and so I just wanted to make sure you're aware of that. And I know that Gene will be covering that here just in a few minutes. Are there any questions for the Treasurer?
Questions for the Treasurer? Financial Secretary.
Good morning, everyone. This is a busy time for me in the year. We have the dues invoices. They were mailed out December 31st out of Ocean Pines in the Berlin Post Office. Reminders will be mailed out February the 15th. I got a short list, but I do want to read the companies that I haven't got the dues from. If they're online by Zoom, or if they happen to be here, they can take it back. Allegheny County, I got Baltimore Pike and Ellerslie. Anne Arundel, it's Arnold, Arundel, Glen Burnie, Harold Harbor, Maryland City, Orchard Beach. Culvert, Rescue, Dive Team, Dunkirk, and Solomons. Charles County, Benedict, Dennisville, Indian Head, Nanjamoy. Dorchester, Neck District. Garrett, it's Eastern Garrett, Kitzmiller, Northern Garrett. Howard County is Ellicott City. Kent County, Betterton. Montgomery County, Bethesda, Cabin John Park, Glen Echo, Kensington, Laytonsville, Sandy Spring. PG County, Boulevard Heights, Brandywine, College Park, Greenbelt, Kentland, Landover Hills, Laurel Rescue, Oxon Hill, Marine Volunteer Fire and Rescue, and Riverdale Heights. Queen Anne's, Sudlersville. Somerset, Lower Somerset EMS, St. Mary's, Mechanicsville Fire. Wycomico is Pittsville and Powellville. And for associate members, we have Montgomery County Volunteer Fire and Rescue Association, and also the Department of Fire and Rescue, and PG County Fire and EMS Department, and our sustaining member, VFIS. I have not received those dues as of yesterday. So that's the report.
Questions for the Financial Secretary?
$200 for dues.
Okay. Budget.
Okay. Excuse me. As Ron mentioned, the finance team and the budget committee met, some personally, some of us by Zoom, on the 1st of February to discuss the additional appropriation money. And there was a list of items, many of which are one-time items, that we considered to bring back to use up some of those appropriation funds. I've given you a list of all the items and estimated costs, and I reiterate, estimated costs at this stage, that the Budget Committee and the Finance Committee are recommending to the Exec Committee for approval to allow us to move forward with those additional appropriation funds. Do you want me to go over each of the items, or?
Why don't you go down the list, because not everybody in the audience has them.
Okay.
And I think that'll help.
They're putting together a replacement plan for laptops for both the MSFA and the ladies. And a 5 to 7 year replacement plan. The estimated cost this year would be $6,500. One item last year for the voting at the convention, I understand that all the officers' computers were kind of confiscated in order to do that. So we're recommending that we lease computers for the convention for the voting, so that the officers still have access to their computers during that time period, and that's estimated at $1,000. We're putting additional funds in for strategic planning at $10,000. We're proposing that we buy an SUV for the executive director that would be wrapped with some form of a marketing message, so that in her travels the MSFA message gets around. That's estimated at $55,000. And an item that I'll go into more detail later, but we're proposing to increase the executive committee meeting costs for hotel mileage, and that increase is estimated at $23,000. Estimated $2,400 for cell phone costs for MSFA staff. It's proposed to get hotspots, Wi-Fi hotspots for the elected officers, so that they don't have problems in some areas, and that's estimated at $15,000. They're going to purchase a second credit card machine, estimated cost $1,500. We're putting an additional $6,500 in for MSFA awards. It's proposed to buy a server printer for the Crofton office, estimated $6,000. We're proposing to add GPS to our trailers at a cost of $500. Understand that one of them disappeared. So we're hoping putting GPS on them that can be eliminated in the future. Proposing $6,000 to wrap the trailers and to secure storage areas for the trailers. We're putting $30,000 forward for cancer screening tests. We're adding $20,000 for smoke and CO alarms. We're adding $30,000 for hearing impaired detectors and for interns for the fire marshal's office. We're putting up $50,000 for fire prevention pub ed grants and the Alert All contract for fire prevention products. And we're putting up $7,000 to upgrade the AV committee hardware and for 17 State Circle phone and conference ability. That totals approximately $270,000. We're asking for the exec committee to approve an amount up to $300,000 to give the budget committee and the finance committee the leeway if those costs change to add to this year's budget.
We want to go ahead and cover the travel expense because that would be part of this.
Yes. As you'll see from the form we've given you, the guidelines for the travel doesn't change. It's one-way mileage, but we're increasing the mileage reimbursement 0 to 50 miles to $60, 51 to 100 to $80, 101 to 150, 100, 151 to 200 is $120, 201 to 250 is $140, and 251 miles to 300, $160. We're proposing to increase the stipend for lodging to up to $100 per night. That's the proposal from the...
And that would be effective this meeting.
Yes, effective today.
Any questions for the Budget Committee? Hearing none, I'll entertain a motion.
Mr. Chairman, I make a motion that we accept our report.
Roger, Randy. I'm sorry, question? Okay. Got a motion from Roger Stager, second by Randy. Any discussion? Hearing none, all in favor say aye. Any opposed, no. Motion carries.
One final note, the budget forms for next year's budget have been given to Secretary Cox. So any committees, if you wish to have a budget for next year, please get one of the forms, fill it out, and get it back to the Budget Committee.
Okay. Ways and Means?
Okay, the Ways and Means Committee, we attended Sunfest in Ocean City, and we only did $5,206 there. Usually it's a lot better, but we got rained out on Sunday, and they shut everything down again. It's kind of being a habit down there. We're losing a day or two. So far this year, we've brought in 11,794. We are behind last year's, but it's hard to tell at the exact point because last year we only had 3 meetings. This year we have 4, so the dates are off. I'll have a more detailed where we are compared to last year at the next meeting. I appreciate everyone getting the tickets out. The executive director has changed the notices that she sends out on the weekly basis for the executive committee members to for information for their particular counties to give out to their associations. So there is updated information there. And anyone who is willing to come down to Ocean City on Thursday, May 4th through Sunday, May 7th will be Springfest. And I've asked, we definitely need help. That was part of the problem at Sunfest because we were overwhelmed with people. We couldn't open one side to tent. We now have a 10 by 20 area, so we have plenty of room. We just need the people behind the table to take the money. Any questions?
Questions for Ways and Means? Okay, thank you. And it's my understanding we do not have a report from VCAF this meeting. Thank you. Legislative branch, Legislative Committee. Bobby, you ready?
Thanks, sir. For the record, Bob Phillips, Chairman of the Legislative Committee. My report has been filed online. I'm not going to go over all that word for word and read it and bore you. I would only ask that anybody that has brought up my report online, please destroy that report. I don't want to look like the 3-year-old that wrote it for me. I apologize. I did write up a report. It was a rough draft. Then I edited it, and I sent the rough draft in. So it was a 70-plus-year-old that wrote it, but he hasn't got the memory of a 3-year-old. With that being said, I would like to say that the session this year started off quickly, and we were not in front of the 8 ball. We were maybe parallel or slightly behind it, but we got caught up to date rather quick. More on that in a second. I will speak about the reception. From everything we've heard from our members and our partners, everybody was very impressed with the location, the venue of it, and how well it went off. There were some concerns with the quality of the food. They've been addressed with the vendor, and they were not happy that their venue was not up to their standards. We're working on that as we speak. As you heard earlier from Director Cox and others, the reception was very well attended. For whatever reason, I don't know, but it was very well attended. A lot of interaction with the members of the General Assembly and their staff. And because of how well it went off, we are presently have already picked a date for next year's reception, same venue. We will have it on January the 16th of 2024. That's actually the Tuesday after session starts. Session starts, I believe, on the 10th. We're on the Tuesday following. So that's already in the works to get that taken care of. Like I say, this year started off quick. We got our agenda out there. We had income tax subtractions. We had some issues left over from last year. We had some language with the VCAF language where the MEMA actually became the Maryland Department of Emergency Management, so we had some language changes there. We got those out. Fire, police lighting, again, left over from last year. As of last week, some of our bills we haven't seen. I've been reaching out to some of the members to find out what happened with them. I can tell you that bills that were read in Budget and Taxation on January the 19th are still sitting there. They've never even been up for a vote. So I don't know what's going on over there. We're in the process of trying to find that out right now. You heard the Budget Committee give a report. We've asked for some updates to our office equipment. Speaking with the Financial Committee, speaking with the presidents, we are making plans if the budget passes. We'd be upgrading computers and printers in our office. Well, it did pass. Well, it's not in my notes, sir. It didn't pass in my notes.
I just wanted to remind you, it passed.
Okay, well then we are proceeding with audio and video equipment and a new phone system. Right now, we still got a copper-wired hardline system, which we call a POT, or plain old telephone system. We'll be upgrading to a voice-over IP system. We'll have video conferencing available in the office now, and it'll just be moving into the future. We're still stuck in the 1960s in some forms in that office. We make do, but through the generosity of the Budget Committee and everybody else, we'll be able to move up, and looking very much forward to that. The only other thing I'd like to say is thank you to everybody that has helped us out so far this year. The ladies in the front office, Marion and Terry, Rosa, Barb, they come in. They're there 4 days a week. Our office is open from 7 o'clock in the morning until at least 1500 in the afternoon. Somebody's always in the office. We actually have 2 people in the office in addition to the ladies in the front office pretty much every day. So it's a lot of effort on a lot of people's time and travel time and whatnot like that. I'd just like to say thank you for that. That would conclude what I have to say about my report. Are there any questions?
Any questions for legislative? Just keep up the good work.
We're trying. We really are. And I'll make a note here that it's been passed.
Okay. Federal legislative. Bob Cumberland, go ahead.
Thank you, Mr. Chairman, and good morning. You all should have a copy of my report. I know it didn't get in till late, but as Bob said over here, we're working every day and up to the last minute. I think the big thing is the very first page, the Obama's and National Defense Authorization Act did get passed and signed by the President, so all the AFG and all the grant program money was approved and put into it. Couple other major things, the protecting firefighters from adverse substance, the PFAS Act, the President signed that act, that's PL 117-248, into law on December the 20th. So we got to keep an eye on that. There's a lot behind that bill, a lot of different materials on that, and I think there's part of that is a bill within the state that we're following, and I think I know one of them particularly we were looking at, I think 460, the House Bill 460, I think is
that the agriculture or is that the
oh no, I have it on the back there out on the table, but that was the other big thing is all the bills that didn't get passed in the 117th Congress. There are some of them that will have to be refiled, and I have listed all those or most of those in my report. I won't go through them, but working with the I-Chiefs and the NBFC, hopefully we can get all those bills refiled. One I have not checked on yet or have not heard is whether Senator Cardin and Van Hollen is going to reintroduce their $1 billion reconstruction bill, and I'll be following up on that one. But I would ask all of you to look at my report, and I won't have to go through it.
Any questions for federal legislation? Okay, thank you.
Want me to do the out-of-state wall?
Sure.
I did supply, we don't read the first copy to destroy that one, like Bob said. That's what happens when you work after midnight trying to get your reports in, working in the dark. I have listed all our neighboring counties' convention dates and locations. They're all on there for you to put on your calendar if any of them you want to go, and for the presidents to get that on their calendar. So I do have all the dates and locations for the 23 year conventions of all our neighboring counties. The first one coming up will be the Cumberland Valley Firemen's Association Convention, and that's August 2 through 5, and that will be at Singley Steam Fire Engine and Hose and Ladder Company in Elkton on August 2 and 5. Also, Cumberland Valley's booster meeting is the same weekend as the John Hoagland Scout program. So we'll be in Mooresville for our booster meeting, which is out by Pittsburgh. And that's tied in with the fire and the EMS conference at Mooresville. Other than that, hope everybody can read my report and check out the dates. Thank you.
Questions for out of state? Okay, thank you. Mark, you already talked on fire law books. Do you have anything else? Okay. Frank Underwood, 17 State Circle. And Teresa, start over. Yeah. Frank, I'm going to do you. Teresa's going to take a little longer. Just push them out of the way. They've already reported.
Well, as the story of the lease continues, over the last several months, the first thing we got was another piece of paper dealing with insurance. I thank Chip because he took care of that. I have received 2 requests. One was actually for the bylaws, which was the first thing listed on our website on the first page. The second thing was a financial statement, and the biggest thing that really got me was wanting to know if we had any financial involvement with the country of Iran. Now, why, I have no idea. I have, like I said, it's about every 3 or 4 weeks or so we get something else. It still, once it is approved, has to go in front of the Board of Public Works. And with the political thing right now, I don't know if that's continuing the Board of Public Works to get the governor's feet wet or what's going on. I did luck out because we had ordered keys in June. I did receive the keys January. Those keys are made out of a special metal, which somewhere on a freighter outside of some foreign country. We receive them, they go to the locksmith, then the locksmith sends them down to a place in Virginia that laser cuts those keys. I do have them. I have to number them. It's the only thing I have to do and make sure that they work. God help us if they don't work. It's another 6 months tied up. But that, as far as 17 State Circle, other than that, I kind of stay away during the legislative session and wait till they leave and go in and see what has to be done. That is my report, sir.
Any questions?
Do we have any financial things in Iraq?
No.
It's just all the other countries. Anyway, that's my report, sir.
The treasurer emphatically said no. Teresa,
That's the kind of stuff we
MSFA name change.
There you go. Thank you, sir.
I do. So where do y'all want to start?
Your report.
So we've sent out the data. We've showed the data. We've had one meeting so far, the town hall, which, give and take, we had some people there. I hope that the messages are getting out there, the information's getting out there. We need to share the information and ensure that it's shared. The next one is going to be at Branchville, then Washington County, and then the next one will be in Huntingtown. A lot of people have called me, questioned me. We've shown the stuff, I've sent the stuff. But my question is, I hope that you all are sharing it to your respective counties. It's important because this is an important matter in our sense. So I do have the ability for people, if they want to show, and I was told to bring it here, I have my laptop set up, so if anyone wants to see the actual process on how you will vote in Ocean City, I have that ability to show that. We did have a executive meeting about that. The changes were made to reflect so that it wouldn't confuse anybody. So that's on here, so that someone can come to the computer and look at it and say, okay, it was broken down to the past president section also, like they would pick who it is. It's also unique is, depending on the candidates, a picture will be attached to that candidate so that person can say, is that the person you want? Just so that they're not making sure they're not hitting the right button. I was told that the registration committee, when you go to Ocean City, first we were told they would be giving a number. He does not want to do that. He feels more control and that someone will like mess it up by giving them a piece of paper at registration and then that piece of paper not making it to the next day. So what they would do is they would have the bank of computers, bring the group in, they would sit there, they will punch the code in for you to ensure that the information is there properly. And then you can go and change all the things that you need to do.
Okay, I'm going to stop you right there. During the special executive committee meeting, the executive committee gave direction on how that process was going to happen. And we will be getting back to him and making sure it's clarified at the next executive committee meeting, because too many times over the years, I've heard the executive committee tell somebody this is what needs to be done or give them directions, and they haven't followed it, and we're going down that path, and it's not going to happen.
Okay.
Okay? So if you'll go ahead on the registration other than the process of getting in to make the registration.
So when you come to register in Ocean City, first off, the biggest thing is you are going to make sure that your companies register. Then when they come to registration, that Sunday to register, Monday, which they can actually register up until that Tuesday, I believe, right? Correct? Then that person would walk in and they're going to verify your email to make sure that you're the person on that list. If you're not listed on there, you better have a piece of paper from your president stating that you are now voting for your company. That will be out there also. The process that I was told was ensuring that all that information was correct, but I also told them that they have to verify their emails, because when we were doing this survey, I had a lot of people yelling at me, in a sense, saying, you didn't send it to me. Well, I took exactly what was given to me from the registration, from Kate, cut out what I needed to cut out. I didn't need all their addresses, like their physical address to location. I just took out the presidents, the delegates' information, and then the past presidents and officers, and they all went into the system. And then I only had 3 people kick back to me saying it was a bad email address, because it, instead of having a .com, it had there's a mark wrong. I was able to fix that, a comma or whatever, or they spelled .con. So that was able to be fixed. I never had anybody, when I told that person or those persons that were calling me, I'm like, well, this is the email address that I had. Well, it was their secretary to their own department had written the wrong information. So it's very, very important so that when people come to register in Ocean City, that they are verifying that information with the registration table to ensure that that information is not incorrect, because ultimately that information goes into the procedure book. So I think sometimes people are rushed, they come in there, and they have to give themselves the ability to actually physically look at this stuff properly. And or take a list, take a piece of paper with you, what you registered with, and just get it done and do it that way. But we can only do what we can do. So in the process of getting out the information, I've had a lot of people call me and say, well, you gave us information that didn't register with what you were talking about. Well, when I was invited to meetings, that survey wasn't done right, correct, at closed at points. So information did fluctuate, because the more people that gave information to it changed the outcome. There was data that was released at convention. There was data released in December, and there was data just released a couple of weeks ago. If you look at all that stuff and the voting process, and then the executive order to change the name, brings us to the point where we're at now. I think that's, and this is, I'll probably say something wrong, but we have members in this organization that are not reading, or they're not looking, or they're not listening to what's going on. And I think that's a huge problem, because at one minute I'm showing this, and then they're like, well, that's not what you said. Well, I also said we weren't closed yet. I mean, that's you got to give me the opportunity. But yet, then you want to challenge it. Well, I'll take the challenge all the time. I really don't care. But the process is, we have an executive order to change the name that was voted by this body. I ask that that gets sent back out to the organizations, because I think that will clear up some clarity on that end. The data needs to be shown again. I mean, it's 25 pages. I was not printing 25 pages again. I mean, it is what it is. And it's here if anybody wants to look at it. Our biggest concerns that we've seen in the past, and people still argue, was the voting process. We're trying to effectively make the voting proper. But then I got yelled at because we're going back in person. And they don't think that's fair. I'm like, if we didn't have COVID, we would still be voting in person, no matter what. We had an executive order, an emergency order, allowing us to do business still in the aspect of not being able to be in person. Well, there's a switch that you have to kill at one point in time to bring everybody back into that situation. And slowly that's happening across the state. But I think some people become complacent. But then I get, well, it's so expensive to go down there. I still feel that we should be able to vote online. I can't do that. This process has to go back in place, in person, and moving it forward. Now, if there's technology out there that I don't know about, whatever. But I can tell you what Rick has done to create a very clean and very open process so that people can go in there and feel real assured what their vote is, what it is going to be there, okay? I do know that there's one name that's been submitted that was done prior to the March 1st request, and that was by Kensington, to add the name of firefighters. So I guess the bylaws people will be talking about that, because that was addressed to me. I got an email from somebody else saying, here it is. So that will be one name that will be on the ballot. Then I was asked, well, why isn't our original name on the ballot? I was like, I don't know. That's not my part. That's a bylaws question. So I don't know how that comes about. I do know that that was requested last year to be on the ballot. So I guess that's your parliamentarian people that got to make the clarity. But right now we have one challenge, and that is to add the words firefighters to it. And then just trying to get the information out. I mean, ultimately we have voiced the concerns of people coming to these meetings. We set these times up. We waited for certain aspects to be completed, and we got that done. And then when we show up to Bel Air and there's 8 people in the room and 2 people online, that was a little disappointing. So.
And it was well advertised.
Yeah.
We went to association meetings, we advertised it. We do thank the 2 people that did speak and the 2 people online. You talked about the upcoming town hall meetings. Would you go over the dates and locations again so everybody in the audience has those?
So next Saturday is at Branchville from 10 o'clock to 12 o'clock. The Washington County location is that Sunday, the 19th. And Eric, you have to apologize. I don't know the top of my head, the address, but it's out on the website. We've put it out on the flyers. It's on the Zoom link, and we've shared it. And then the following, that last Monday of the 27th is the one in Huntingtown. And that's all in February.
Kate?
So Teresa, just to clarify, the voting process will not be sent to emails. It will be sitting down at a computer.
Yes.
In the computer room at the convention center.
Yes.
Because I know there was some confusion as to say, even though we made this new process, was it still going to entail emailing the ballots to everyone? And that is not going to be the case, because I think that was where the issue was last year. So I just wanted to make sure that that was reiterated, that this is not going to be an emailed ballot.
And for everybody's clarification, that was discussed during our special executive committee meeting, and that is a directive to that committee from the executive committee, that that's the way the voting will take place. So, come on up.
Just one question while you
Sure,
come up.
what?
Just to clarify, because I know you said there was an issue with like the number and stuff. One place to check in, get your packet, check in, and that registers you to vote.
Mm-hmm.
Okay, as long as that stays in place, because I think that was a huge.
That was the directive from this committee.
I agree. I just, because I know she was given a different scenario.
Mm-hmm.
And I just so that is still there, that there's not a confusion the day they walk in that they have to go someplace. Okay, good.
They get that. Well, the biggest concern was in the beginning was if we give them a piece of paper on to Sunday, how many people are going to bring that piece of paper back? And that's why I think he's going to that one single code so that they open it up for you. So it's not a, by the time I get somewhere, I'm going to lose it.
And that's all well and good, but during our executive committee
you
meeting,
changed that.
and we voted on it, so the 13 members of this executive committee have stated that the registration process on Sunday, we're not saying anything about. For voting, we're doing what we used to do. You report, you check in, registration table verifies, and then whatever they want to do to say Steve Cox is okay to vote, whether they give me a napkin, whether they give me a piece of paper, whether they give me a number or whatever, I go into the room and I hand whomever that, and that's my ticket to that computer.
Yes, that's your ticket.
And-
yes, that's not changed. That process has changed. The only thing
He has put out different information, and I'm making sure, speaking for this committee, that's what we said is going to happen, and it's going to happen.
Yeah, well, they'll get that piece of paper at registration. They're not going to get that code. He's going to open that code. Like, he's going to have additional people helping him with that physical code.
And that's okay.
Yeah, that's
As long as they check in that day.
Yeah, oh yeah, they're checking in. They're not walking right to that table to vote. They still have to do the process. And I guess what we'll do is we'll put a piece of paper together showing when on Sunday and then reiterating this is what's going to happen. I mean, it's another piece of paper.
It can be a ticket.
Yeah.
It doesn't matter. The executive committee said you're going to do this.
Yeah.
Okay.
Yeah. But no, that's the whole.
Yes, sir.
Hello, Mike again. All right, I know this is a big issue right now. Getting y'all an idea for next year, 2024, y'all may want to think about maybe making an ID barcode, and with all electronic today, what we can do, you can scan, you can like, okay, this is Indian Head Fire Department, Newburgh, Prince Frederick, and it will come up, okay, this is Joe Smo, whoever, da-da-da-da-da. Today, technology, what we had today with an ID card, pat tags, all that stuff. For the later future, 2024, somebody might want to look into that. With all the computer we had today, after this situation, of course, but putting a bug in somebody's ears, somebody might look in, that might will work. And that's what I did want to let y'all know.
Thank you. Any other discussion? Any other discussion?
You have the April, it's the April something, it's April,
Doyle?
I think,
Do you,
Yeah, 90 days before convention.
it's
So
90 days, but
April timeframe.
Doyle, do you have the last date for submission? Come to the mic.
The bylaws indicate that the credentials must be submitted no later than the third day of June.
No.
Question,
No, it's
question on bylaw submission.
submissions for bylaws.
The 90-day?
Yes, I don't have the dates on that.
It's in,
The chairman of the bylaws committee.
And we'll get with him prior to his report and ask him to bring that out.
I think it's.
Thank you.
I don't know it's 90 days, so
Yeah.
whatever, back the 90 days, so.
It's usually right after the spring executive committee meeting, right in that time period. Okay. Any other questions for Teresa? Any other discussion on this topic? Please encourage people to come out. Okay, I'll get you, Doyle. Encourage people to come to the town meetings to get the information, to express their concerns. That's why we're doing that throughout the state. Doyle.
Bylaws amendments must be submitted by March the 1st, 2023, 45 days prior to convention.
45, thank you.
Yes.
I stand corrected. March 1st. Thank you. Thank you, Teresa. And thank you for the work you've done. I know it's been frustrating. I know we've talked and you've been at wit's end. Thank you for everything you're doing. I'm going to move to Transportation Committee.
Frank, where you at? Don't leave me hanging by myself. Good morning, everyone. Wayne Tone, Chair of Transportation. We are ready to roll with the recertification, which will begin April 1st at the Executive Committee meeting in Flintstone. We will get out all the lists to the Executive Committee members to distribute to their folks and get out to the companies. At that time, as discussed in the previous meetings, that the recertification or the actual application fee will go to $10, as well as the recertification fee will be $10 for each tag set. I've included in the packet the instructions and guidance for filling out the forms. Please, when your people go to fill out a form, don't just run off a whole bunch of forms. Encourage everyone to go to the website and get the actual form that's current. We've had some problems with some old forms coming in, and the latest update will be Kate, this month. The update date on the form right now is this month. That's when the fee will go up. Will be the 1st of April. So the form online will be updated on April 1st to reflect the change in fee. We've had a couple issues. Handicap tags, folks have to get a hanger for it. If you're running fire department tags, just get a hanger for your mirror. There's nothing we can do with the tag to indicate handicap on the tag itself. And if you have a temporary tag, you cannot get FD tags. You have to get your hard plates and then reapply to get your tags. And we don't need a copy of the registration form. The form has to be filled out with the required information on the form. Thanks to Lynn and Kate for their help in getting this prepared and ready to go. The last county, of course, is PG County. We left the worst for last, I mean the best for last. So they're the biggest county, and Frank's going to be on top of that as far as getting them entered into recertification. Yeah, I'll let you look through it.
One problem we've had in the past, people go to motor vehicles and they have their FD tags and they want to transfer them over. MVA goes, huh? What's that? Kate's got a letter and it works great. We just did it on my daughter's. But she will send you a letter saying that you're authorized, but you just got to have your tag number and what's that other? IDO, whatever number. There's 2 numbers that she will put on the letter and send it out, giving the MVA authority to transfer your present tags. Because if we get a past president or something other that hands their tags in, God help you getting a new tag. We've been through that route numerous times. So that's one of the big things we've come up with, and it seems to work. Actually, Kate came up with it, but I'll take credit too. Okay.
Yeah, just everyone stand your ground. Don't give up your tags and let the dealership bully you into tags that we're going to have to resurrect. Don't hand in your tags if you have a problem. Just take a temporary tag, take your tags with you, and then we'll get you straightened out through your local MBA if needed.
One more thing. Tags are issued. Remember, motor vehicles works under Department of Transportation. We do have a new Department of Transportation chief that the governor just assigned, and he's coming from Metro. So don't lose your cars or you may never find them either. It gets complicated.
Any questions?
Any questions for transportation? Frank, did you think of anything else?
I don't know. I got a guy with a screwdriver out there now taking black tags off the car.
Thank you.
Steve, there has been some people that do not want to get the new logo tags because they don't like them. But if something happens where your tags are tattered or don't get recertified, you're going to have to give up those tags and get new ones. Or, the new logo is the new logo. So.
And that was voted on and approved. Presidential vehicle.
Okay, usually we can sit up here and say everything is going good and whatever. No, not this time. All right, so as reported at the last executive committee meeting, we received 2 new trailers. One was assigned to Teresa for public education and fire prevention, and the other one was assigned to Chris for the audiovisual equipment. Chris had the trailer at Shao when we had our last executive committee meeting. He hauled the equipment back, took the equipment, thank goodness, out of the trailer and stored it, parked the trailer at Arbutus, had a tongue lock on it. 3 weeks later, he was driving by and the trailer's not there. So they went back and did the video search with the security system at Arbutus. They do have a pickup. Backed up to it, cut the lock, off it went, never to be seen again. And of course, it's never been wrapped. We didn't even have it titled yet. It was that quick. So it's been turned into insurance. We're still waiting to see how much we're going to get back from the insurance company on that. They are not handling it as a vehicle. I believe it's going to be equipment. So we're still waiting on that to come back. And Chris we did order a replacement trailer. So that one will be appropriation money. That was part of what you approved earlier. So that will be ordered shortly. In fact, I have the paperwork for Ron to do the check since it's been approved. The trailer that was assigned to Teresa for fire prevention, we have got that to MVA, and that has been titled, and we have LG tags on it right now, but the special tag MSFA 6, I believe, is going to be added to that unit. As soon as those tags come in, we'll be good to go. Sealed bid was received for the trailer, the Neo trailer that Chris originally had. And talking to Chris, that trailer is available to be going today. And I do have one bid here that's still sealed. And I'll open it at the end of the report. And then we can dispose of that one. In June, back at the executive committee, funds were approved to purchase another SUV for a president for the replacement. The committee is ordering that replacement and hopefully a projected delivery date of June 2023. We'll see where that goes because they're behind on everything. Okay, since the last executive committee meeting, President Kurtz's vehicle was keyed. Where was it, Ben? It was some parking lot you were at when you came out. There was a Sawball's, wasn't it? I think Sawball's up. There's a grocery store up in Whiteford. Took the key down the side of it, so that's going to be going to Plaza Ford for paint repair. And let's see what else we got. Skip, your vehicle he backed into one of the utilities from Ocean City. That all police report was done on that, and that was filed with the insurance company. They're liking us anymore. So we got that one covered. And with the approval a couple minutes ago with the appropriations, we will be installing GPS units on all the trailers, and at least we can keep track of them and see where they are if they disappear. And we do want to brand them, as we call it, with the MSFA logos or whatever is appropriate. We want to wrap them so maybe nobody will take them this time. And that was the problem with the first one. They got it before we could do anything with it. And the last thing I've got is an SUV. We want to purchase it. We're requesting that. That was approved in the appropriations also. And this is a replacement vehicle with the executive director's vehicle. It's a 2016 Taurus, which was originally a presidential vehicle. Kate, I'm not sure the mileage, 120, 130,000 on it. Yeah, about 120, 30,000 on it. So the new SUV will replace that vehicle. We've already contacted Plaza Ford, found one. We have the state contract price of $45,529, and they are actually, it is red. It's not our red, it's red, but and that's going to be yeah, like that one. But we're going to put some messages, wrap that some type, not all over the vehicle, maybe in the windows or something. We haven't talked yet exactly what we're going to do, but some type of messaging on it to get the MSFA logo out there. And then we would go ahead and advertise and solicit bids for the TARs. So that's the report.
I'll entertain a motion to accept the report. Motion by Ron Block, second by Randy Smith. Any questions? Any comments? All in favor say aye. Opposed, no. Motion carries. I'm going to turn the mic over to the acting vice chair because knowing the report and knowing you only had one bid, I know who the bidder is.
You. Yeah, I know who the bidder is too now. Steve Cox, I'd like to place a bid on the amount of $300 for the advertised 5x8 trailer MSFA has for sale.
Okay, any questions? Wait a minute, any motion or anything? Motion to accept the bid. Second. Motion by Randy, second by...
Did you get approval?
Ron
I just
Block.
heard comment behind me. She said no. Where are you going to put it? What's that for?
Randy Smith made the motion to accept and Ron Block second. Yeah, it is. It depends which one you call first. Yeah, I think so. All in favor of the motion signify by saying aye. Aye. Opposed? Motion so carries. Thank you, Mr.
Thank
Chairman.
you. Steve, cash only.
All right, you're back. Checks in the mail, it said.
Yeah.
My treasurer's going to handle it.
No, she's not. She said no.
No.
No, she said no. She said no.
Okay. It's close to noon. President, are we ready? Okay. Well, come on down. Stand up so people can see you. I mean, here.
Gosh, I get such love.
Hey, I might need your help in a minute.
Oh, I'm going to be the protector now?
Yeah.
I want to thank everyone for their donation. The winner gets $210. And the ticket number is 1522911.
911?
1522911. Harvwoods.
Same old crowd.
Here you go, sir. Thank you.
Chaplain. If you can stay with us one more minute, Chaplain, if you'll give prayer.
Please join me in prayer. Almighty God, as we take this opportunity to break bread together, Father, we just ask you to bless this food and bless those who have prepared it, that it nourishes our body as we continue to serve you. We ask this all in your name. Amen.
We are recessed until 1 o'clock.
That's right.
I heard insider training, but insider training.
Well, when
Can you announce that tomorrow when you do your department season?
I certainly will. Yes, sir. Thank you. Thank you.
Nice to stand up.
Yeah.
But the other part,
Well, and in fairness, I wrote the report talking to him, and when he said we only got one bid, I'm like, shit, I only threw the bid in just to make somebody bid at all. Oh well. My son-in-law.
Yeah. That was the purchase. That was the purchase.
So the back of page 2.
They won't make a new one. Right.
That's all Doyle.
So the back of, I guess, whatever is after the awards branch for tomorrow needs to be reprinted. So like it ends there. I don't know what comes after awards. Because that's going to confuse you tomorrow.
Yeah, I will take a look at that because
That's the second page.
I
for
am.
today. And then it goes to here, but so maybe it ends.
It ends there. That
okay,
ends.
so
That's
the
it.
back is just nothing.
Nothing.
All right, so
Why?
this just printed accidentally.
Yes,
Okay.
yes.
Just wanted to make sure
Yes.
so nobody's looking on the back waiting for you. Okay.
Nobody said you had to get checks.
That's okay. I adjust this one
Nope,
as I go.
I am going to get out of here while getting started.
I do a mask. So I just shuffle things. But yes, the new one's good. Moving right along. I don't know. We'll have anything to do tomorrow.
Oh, man. Oh, they were terrible.
I don't think VCAP's got anything. Yeah, and all you got is the EMS no training committee report. I did not see it, but is it? Okay. Well, I was on the meeting with her. What a joke. I mean, it's even worse than a joke. She literally says, I don't know why I'm doing this. She says, I have no idea what I'm supposed to be doing. She told us on the call, on the committee. She says, I don't know why I'm here or what I'm supposed to do. I've got another issue going on with her. That, see,
they've got these people with skills, the CMT skill, instructor skills, and all mandatory training, 6-hour training that you've got to go to, okay, mandatory. And then she decided not to send that into MIMS to get continuing ed credit. So, MIFRE, because it's a MIFRE class. And I talked to Steve about it, and he says, well, she's supposed to call you about that. And I said, well, she hasn't called me. And I said, that's wrong. I said, you have to be an EMT or a paramedic to teach, okay? Particularly if you're a paramedic, you've got national registered requirements for continuing ed. Most of your EMT instructors are national registry because they have to keep up with the test. So they've got requirements also. So they need to be getting continuing ed credit. And, you know, and like I say, I sent her a letter on behalf of the MS committee to do something about that. And she came back and said, oh, well, it's only a couple hours. It's 6 hours credit.
We had a special spare tire that we just say you take a wood weight and run about that much wire. The rapid seems rather beat and just drop. Yep. Be safe. Have a safe trip. 100%. What do we got? Baked beans.
That's just where it goes. That's right. That's right. Yeah. So you're going to do that. You're going to do everybody. We're researching everybody in April. Yeah. So I think they're all with you county, but I don't think I got there. Because over cities got 4 or 5 members that got it.
Report filed electronically. Yeah. And
You're not putting it on nothing.
I just, like I say, put down the highlights, what's going on. Yeah. Report file electronically. Year started off quick, blah, blah, blah. You know, just stuff like that. I never did minutes. Yeah. That's what you do. But yes, sometimes somebody will get up, like the young man that stood up there and talked to, who was it earlier? I couldn't.
Trace was up.
Yeah.
So I'm just looking. You got the baby 60 grand.
right. But yeah, I mean, so I don't have that, but I do have an adapter. Yeah, full size. Yeah, I've got an adapter. It does all that. Yeah, because I can give you the one. Is that yours? Oh, okay. A couple meetings ago. Yes. I guess, like I say, I just use it to get information, so. Yeah, it's got one over here. Right there. Oh, I see it. Okay. Yeah, it's right in the smokestack there. Yeah, hidden in the crown and anchor. There you they go. Call that the crown and anchor. On a real criminal. Okay. There you go, Charlie. And, thank you. And then give you the copy this afternoon. Okay. We're going to finish up tomorrow, and that way, if you miss something or you want to add something to it, that's there. Yep. If you don't need it, just delete it. Yep, that's great. That'll work. Smells good.
Okay, thanks.
Congratulations on your trip. I'll buy it for you for 200. What's this? It'll help me get on Nancy's good list.
No, actually, it is, but it isn't. I just gave it to Chris. Another thing, this space, it just seems like it gathers up on you.
Pittsfield, Powellville. Go to some of the mess.
Nobody else is running it. How's that? Take up a fun, see if I get somebody else. Well, I think, the right reason, like you say, it's good, I'm glad, because we've got this tremendous amount of experience here. And happened was one with the Baldwin County, but a member of our and the other was a member of our company working for the fire network. But you're still, and even you get more involved because it's like you really have to look up the little stuff. And yeah, it's. And it's actually easier to follow. Whenever y'all want to talk about it, let me know, and I'll come see y'all. That's good. That's good. And people don't realize what's involved in that. To have somebody that is right there. Yeah, I was fortunate, I guess. Our chair, Doug, I mean, we know each other, and so it was so easy. Right. I haven't seen him today. That's right. That's right, yeah. Jeff Clemens is here. Jerry's here, Doug's here. 3 out of 4. Oh yeah, that's right. I did see him here. Yeah. Yeah. You get that out of it. Doug Simpkins is here today. This gets to be a challenge. Sometimes you don't know what you get yourself into.
What's happening, buddy? You all right, buddy? You need anything? I ain't voting for you anyway. I know you're not, but listen, I'm going to vote for you.
that trick, bro. What should we think? I'm still with the county, but I'm with the party. Yeah. Wow, I'm working over there. Yeah, that's great.
Hey, Dan, how you doing? I was just going to see you, but you were busy getting your food, and I was just...
Present.
How are you, Ron?
Got a few more months left, huh?
That's right, that's right. Doing all right, good to see you.
The journey's been short, huh?
It's been quick.
Quick, hasn't it?
You know, from the top installation.
Yeah.
But believe me, we ate dinner at 7:30, and it's 20 after 8.
Oh,
So it
okay.
took me longer to get there. Yeah. And they had 6, 7.
Really?
Big truck. No. Don't think everybody can tell. That's the issue. Okay.
So do you need me for anything?
Hey, Tim.
I was going to ask you the other night if this is who you were talking about.
Yeah.
How'd you way down here, did you?
Yeah. Well, family's in Annapolis visiting with family, and so I was like, all right, I'm at Annapolis. Yeah. Sport mode. Let's go.
And it's not to me. He doesn't give it years ago. It's unbelievable what he's capable of doing.
And that's why, you know, when I was looking at Eric, he said, well, they're already doing it. People don't realize it's not a lot of money. I mean, you know, but if there are grant programs that can be started, or they can start creating these types of drone programs with grant money or whatever, or even raising funds for it within the department. But I want people to understand the biggest thing that I learned from him is that really needs to certify it. Why? Because you can't just have one and fly it up because there's laws about it. So that's kind of what I was like, I would love for you, and I would love the NSFA, maybe not this year, maybe next year, have a drone committee where you can have not drones themselves, but have the information, like have the links to the FAA courses, where to get a grant for that.
What you need and this is what you want to do.
And I think it would draw in a lot of recruiters who are not even younger, but tech savvy folks that might not want to do fire, might not want to do EMS. This is their way in, if they're techie and they love that kind of stuff, to bring new people into your departments. So I just think it's interesting.
And I think a lot of people in here, if he shows those couple of video clips that he has, I can't remember the video clips, it's still whatever, but he showed a couple of, he just did this for the fire stuff. It's unbelievable what he can see.
But I know, like, for United Communities, we had one guy who wanted to apply and we lost touch with him. I don't know where he went. But he was, you know, former military. He had the license to apply. He had his own. He was going to join our department, which is great for us because we have the brush. We have the, you know, the weather stress right out on the day. We can hover over and find out what's going on. Get eyes on the patient before the boat even goes into it. I think so too, depending on the model. Yeah. And you get your heat sensor and all that kind of stuff. Pinpoint a lost child. I mean, it's just so many, like what our MSP does. And it's not only for the fire service either. I mean, you could have, like Queen Anne's County decide to do the drone program, you know, with the sheriff's department.
There's a lot, I'm not thinking, you know, they're huge assets. It's a lot cheaper.
And they can get into a lot of other, you know, more difficult terrain, so to speak. So, but I'm excited to have him.
Well, like I said, I was going to ask you the other night, is he from Ohio?
Yeah. Yeah, he went into detail. I don't know. It was in our first one.
We were fighting the sun this morning on the computer.
Yeah, oh yeah, sun was right in my face.
We're gonna have to go. You gotta throw down here.
He's just doing that.
5-minute warning. We're going to start in 5 minutes.
Yeah, we'll invite people to stand up behind if they want to post their.
Okay.
Presentation, maybe if people are stand up along here so they can see it better. Invite them to do so.
Mystery already.
Ladies and gentlemen, please don't forget, if you get an opportunity, to come to the back of the room and pick up a 50/50 ticket for the Prince Frederick Volunteer Fire Department. If you get an opportunity, come on by. Thank you.
Get Ron up here soon. Yeah. He said something to you. I said I'll remind you. Right? Steve, he said, yeah.
What are they doing with the back to school?
That's the problem. That screwed up registration last year.
This is what you're going to do. And we are
There are people in struggle. I'm not saying there's not. But there's going to be people in store that you mentioned. And I respect those who walk away with it.
I'm watching.
That's how it was before. And I don't think, I'm not sure what bylaw thing, but I think bylaw thing was supposed to close it.
Yes. Ladies and gentlemen, please take your seats. We're going to begin again.
just a second.
I like that. Going to call the meeting back to order. We're going to begin with the Ways and Means drawing. Bessie Marshall, I'm sorry. Sorry.
All right, go ahead, Tim. Pick a ticket, please.
Blame the fire chief, you all don't win.
Hold on, let me get my glasses on. Okay, the winning ticket, 934460.
Steve, you want to check your tickets? 'Cause you got a lot.
934460.
Hold on.
Spin again, man. Your check.
Here we go, one more time. 934460. Oh, quit looking, sir.
Thank you.
Laurie, please verify her ticket because she didn't know who she was earlier. Okay, continuing on, we're going to deviate from the program briefly for a drone program presentation. With us, we have Assistant Chief Ryan Brenneman from Allegheny County. Ryan, the floor is yours.
Thank you so much for having me. It's a pleasure to be in front of all of you. I've had the privilege and honor to start a drone program, a drone responder program in Allegheny County, Maryland, and Kate has asked me to share just a little bit of the best practices and information that we've been able to achieve so far. Being a FAA certified pilot for a number of years now, I was approached by a volunteer fire department who had purchased a drone. It was in a closet for several months and they wanted to get the program off the ground. And so we looked at this from a perspective of how do we do this as far as policies and procedures.
When he's showing the slides, if you'd like to walk up, please feel free. Sorry to interrupt you.
No worries. So we're looking at this from a number of different avenues. How do we recruit members to join this program who otherwise might not be affiliated with the fire department before, and then from a policy and procedure perspective. So that's how we'll take a look at this. So drones are pretty familiar to most people now in what they do. And one of the things that we first needed to evaluate is what is their use case scenarios, because there's so much more than just what you might see in the news or what you may have for real estate photography and stuff like that. So really there's a couple different use cases for drones. The pre-incident planning, that's probably something that gets overlooked a lot, but the drone can take a look at the roof structure, determine what type of construction, confirm any hazards. Based on the model of the drone, you can use this to identify issues long before the emergency incident happens. Of course, emergency response, and we'll go through the different response levels that we've experienced so far. And then, of course, public relations. So anyone who's flying a drone, these drones are equipped with phenomenal cameras, and so you're able to utilize that video and photo to be able to tell the story differently, which, as we all know, public relations is a key part of the fire service. The other thing that's not listed here is something that is happening more in Europe. I was just in Spain last week. I had the chance to meet with Barcelona Fire Department as they look to deploy what's called a drone first responder program. That's where there's drones strategically placed throughout the city, and the second that a call comes in, the 911 dispatcher sends the drones up in the air. It flies automatically to the region of where the incident is located and gives first responders a perspective even before their arrival. You're able to confirm working incidents much quicker and or any other hazards, such as if you're along divided highways, what's the best route and access into that. So the types of drones that we're going to talk about, Corriganville Fire Company had a DJI M30T, which is a somewhat larger of a platform for a drone. It features a 200 times zoom lens. For perspective, you can read a license plate perfectly from about 700 feet away. So if that gives you an idea of what 200 times zoom lens would do. It also has a laser rangefinder, dual redundant GPS, of course a thermal imaging camera, and about a 35 to 40 minute flight time. The other accessory that we were able to purchase through a grant was a loudspeaker and spotlight. So we determined that on a lost person incident, we would be able to launch the drone. We pre-programmed a recorded message that gave off 1 through 12, and then we would fly it in a circle. If they had communications with our comm center, they could tell us where they heard that the loudest, and then we could start to dial in a position. With the dual redundant GPS, we can actually tap the screen and within about 8 to 10 centimeters give an exact latitude, longitude coordinate of where that person would be located. The other drones that we've used in the service is Mavic Pro. This is primarily used for support and or PR missions. This is just a civilian type drone. This drone, the DJI Phantom, it's white. It's probably the most synonymous drone that's out there. This is great for 3D mapping, so we can actually create point cloud data of a building or of an incident. It's really fantastic for after the incident, then you can go back and take real accurate measurements and look at the structure from a point cloud. And then finally, an FPV racing drone. This one is really designed for like sensory. Some of the larger drone platforms, you can have 2 people controlling them, you'll have a pilot, and then you'll have a person controlling the main camera. And by using this type of drone, we can put goggles on them and get them associated with the first-person point of view. So I mentioned earlier about the response types. The key one that a lot of people think of is the search and rescue mission for lost or a missing person. Using the thermal capability, being able to adjust the sensor and the readout of it, you're able to really start to dial in and identify a person quickly. Obviously, much easier in the wintertime where there's not much canopy over the trees, but certainly it affords the opportunity to be able to find somebody quicker. Structure fire response, listed down as a safety overwatch, and I have a quick video clip at the end that will show that perspective. But oftentimes on a large commercial assignment, the master streams may be in operation, and the drone can confirm very quickly and easily, are we putting the wet stuff onto the red stuff for the fire to go out quicker? So a lot of times things are banked down by smoke. If you can see it on the left-hand side of the image, you just don't have great confirmation. And so utilizing a drone, you can direct master streams a little bit easier. Of course, for hazmat, both recon and identification, there are accessories that are made now for public safety drones where you can actually send up something like an Altair gas meter that's cellular enabled and report that information back to the command post. From there, we can start to do atmospheric monitoring from a drone at different heights and variations in distance from the incident. Water response. So the image on the left with the boat, this was actually something long before I joined the fire department. I own a media company in Allegheny County, and a water rescue came out. I happened to have a drone with me in my car, and I caught the Swift Water team actually picking a person off of the telephone pole. But as drones have increased in popularity, so have the accessories, and now they're having kits where you can actually drop a life jacket or a throw rope bag to the person with the drone. And so we're near a lot of water here, and that could certainly be useful. And then wildland and brush fires, to give a perspective, you can use the drone to draw a box and it'll give you an approximate acreage. And so that's a quick and easy way to be able to determine has the fire broke past your fire line or not. So some of the team roles that we had in our program is a pilot and flight support, and this talks about the recruitment aspect, but to be a pilot, we were looking at 18 years of age, and you would be an FAA licensed pilot. For many organizations, you can seek a certificate of authorization where you don't have to become a Part 107 pilot, but we decided to hold it to that standard. You can get an exemption that does require you to have a visual observer for every flight. With your 107 license, you can fly independently, and we felt that was the best. And then flight support. So getting younger members active, they're able to not only be a second eyes for us for the drone as we're flying, but in addition, when we're transmitting data, they can monitor those data feeds. So it's all about actionable information. We can send data feeds from the drone or command post to the comm center or to anyone's cell phone for a real-time view, and the latency is only about 1 to 2 seconds. So some of the recruitment challenges that we faced was the personality of pilots. So when you're attracting somebody different into the fire service, we have to consider what does the fire service think of them and what do they think of the fire service. They may not be acclimated to it. Also, integration into the department. There are challenges with existing bylaws because you're going to bring somebody into the department that may not want to become a fireman or an EMT, but rather just perform this supplementary mission. And so obviously taking a look at those constraints and challenges is critical as well. So some of the things that after the drone was purchased that we started to identify is you've bought the drone, you've got some of the batteries, but what do you need in addition to be a useful program? To sustain 24/7 flights, how many sets of batteries is that going to be? How are you going to get the drone there? How will you view the image from the drone live on scene? And then any necessary PPE. It's certainly not a structural or a medical incident, so what's the best PPE suited for the pilots and ancillary team members? And then finally, the other challenge that we were able to alleviate by basically inviting the press to our station for a demonstration was any of the privacy concerns. So naturally, when you purchase a drone and it has a 200 times zoom lens, we need to be able to effectively communicate to the public that drone is going to be used for the purpose that we intend it for. Also safety concerns. Anytime that you launch a drone up, inherently there are people that are not only concerned about the privacy part, but what happens if the drone has an emergency. And then any of the perception challenges that's related to people that may feel like the drone is a toy and something that isn't necessarily used for life-saving missions of the department. And so there's certainly some perception challenges that we had experienced. So you'll hear some of the audio, but this is live thermal footage just a couple months ago of an incident in Allegheny County where we were able to identify hot spots. You'll see one of the UTVs that are going up the mountain, and we're able to quickly confirm with DNR the containment of the incident, and that was one key aspect of this. And so you'll see the image change for the FLIR. We can modify what we're seeing to best highlight. But with the 200 times zoom lens, we were able to zoom in and look at a UTV. So we could also monitor personnel from the sky as well. So you'll see now where this zooms in. And this is quite a distance up. We were, I think, about 175 feet in the air, and we're able to easily zoom into a UTV on the ground. The other, and this is the kind of the last point here. Let me just zoom forward. So what we'll see here is the thermal camera is engaged. These guys are going to go up and vent the roof. There was a fire in the attic space. You'll see here where the visual loss of the firefighter on the roof. So the incident commander maybe wouldn't be able to see them performing their action, but with that thermal camera engaged, and we can kind of layer those things over top of each other. Now we maintain visual line of sight of crews on a roof to increase the overall safety profile operating during an emergency incident. So not only, in our terms, a great way to be able to tell the story of firemen, but also to be able to increase the safety. And here's kind of what the two images look like with the drone flying during the incident. We make sure not to fly over top of people. But here's the two aspects of how that looks. And then finally, I know this is difficult to see in the back, but this is how it appears for the pilot flying the drone. These things are basically, once they're launched up in the air, they're so accurate that you can just kind of let your hands off the control, manipulate the cameras, and the drone pretty much hovers in place. And then you'll just land, hot swap the batteries. But there are accessories that allow you to tether the drone. You feed it an extension cable off 110, and the thing will stay in the air for as long as you really want it to. Finally, the policies and procedures, we drafted a pretty lengthy policy. I think this thing's 6 pages. A lot of it talks about the digital media evidence that's recorded by the drone and how we're going to archive that. That's an important aspect of it. But also then the privacy and other things as far as chain of command and stuff like that. So that's how we started the drone program. It's evolving, hopefully, to the county level where we can alleviate some of those other ancillary concerns of recruitment and retention. Also a better funding pool for the longevity of the program. In our neck of the woods, it's the only drone that is in the region. Washington County is looking at purchasing 2 drones for their Department of Emergency Services, but they there'll be quite some time, I think, until they take delivery of them. So for Garrett and Allegheny counties, that's pretty much it.
Chief, thank you. We appreciate you enlightening us on the program and the usefulness of the program. Let's show our appreciation.
So when I got the email from Chief Brenneman, he was explaining the rollout of his drone program to Corriganville, and I, thinking of in the future and how technology is going to bring us into the next 10, 15 years, and especially with the way that this program operates, I didn't realize all the facets of it, having to get the FAA license and the age requirements, and it's not just, somebody with a drone at home popping it in the air. And at my station, United Communities, we had a gentleman who was interested in doing that for us, and with us being at the bottom of Kent Island, it would have been perfect for us to, be able to launch something for a water rescue, see what we're dealing with before we even launch the boat in the water. So hopefully it is my intent, hopefully, to work with Ryan and the MSFA Executive Committee over the next 2 years is to create a drone committee where we can not provide the drones, but provide the guidance, provide similar presentations, working with Ryan and his program to see how we can offer the guidelines and the specifications and the guidelines just to create your own drone program within your department. It's here. The technology is viable. It's showing its usefulness, and I think we have a lot to learn and a lot to offer our MSFA membership if we can move forward with providing this information to our departments for those that are interested, and also giving them the resources for whatever grant opportunities and funding resources that there might be out there. So that was the reasoning behind this presentation, and I thank Chief Brenneman for being here today, and thank you for your attention to this.
Can I add just one more thing? I'll just add one more thing real quick. One of the things that was exciting about this is being able to attract new people into the fire service. So while they may not have had an interest maybe in becoming a fireman or in emergency services, by being able to attract individuals who are into technology, it only further enhances our mission. As we put iPads into fire apparatus and we're utilizing technology to a higher level, incorporating people who want to serve in this way is just an added benefit to the community that you serve. And so you can look for students that are in React and robotic programs. The FAA has a database of every certified pilot in the county, and that's a great way to reach out to them if you're going to start a program. Just start sending off some emails to them and inquiring if they would be interested in joining that program. We've had several physicians, a chiropractor and an emergency room doctor, who would like to give back in that way because they are private pilots. And so that's just one more way to gain more members for the fire service.
Any questions? Chief, again, thank you. Appreciate you coming down from Allegheny County. President.
Call number. You get to, well, then you donate it to the department. Thank you. All right, here we go. No. 853027. 853027. I'll give it one more minute. There's various people got more than one sleeve. 853027. Whose was it? Oh, it's donated back to the department. All right, thank you. And for y'all's thing, sodas, water are out, and we also put the baskets out for any snacks for y'all to continue on.
Thank you. Secretary asked me to point out for the next executive committee meeting in Flintstone on April 1st and 2nd, the sheet of paper, the flyer, had the wrong telephone number. The correct number should be 722-0340. 722-0340. And he does have these back at the back table. Next, we'll ask the convention committee to come up and report.
I guess that's it. Good afternoon, and it's been a pretty interesting meeting today, a lot of good stuff, and try to bring you up to date on the convention. Obviously, we've been working through some of the suggestions from the critique that was attended by many of you, and the schedule that each of you have is a draft, along with the mail-out package that'll be going out. We're working with the Secretary's office relative to the informational packet. We are trying to push as much of the information onto the website. We're trying to keep that up to date so that people could find the most current convention information there, and that really makes a difference. It helps answer some of those questions. Exhibit packets are out, and we actually have been getting exhibits registrations a couple a week. So Kate will be talking about that in just a couple of minutes. And the educational programs, hot training, she and Ken Bush are working on all that, and I'll let her and Lynn give a report on where we are programmatically. We have reached out to Jolly Roger Amusement Park. They will again host the Monday night event for all of our families, and they will do the Inlet Boardwalk discount tickets down at the Inlet parking lot on each night for the convention that we're in town. We always like to remind everybody that parking trailers on public roadways involves a permit. If you don't have a permit, you will get ticketed or towed. So just want to continue each year to remind you, don't leave your trailers out on the public roadway. So a couple of changes that are in the works relative to this year. First of all, to critique, there was a discussion with the presidents and the uniqueness of hosting the President's Banquet in Annapolis, away from the convention. And so the presidents have asked us to do that again this year. So the banquet will be on the Saturday night of the Maryland Memorial Weekend service at the Stadium Armory in Annapolis, so that we will host a presidential banquet there in June, the first part of June, and then people will be able to attend the Maryland Memorial the next day. So we've been in contact with Dennis Beard and his committee to try to join some of the activities and maybe even enhance the attendance for both events. So we have a contract coming for the Naval Academy, and we will be working through those details. We have a convention planning meeting next week on the 15th, and then probably what we'll do is put a small banquet group together to look at the activities for the event in Annapolis. Secondly is that, so what that means is there won't be any activity Saturday night. So one of the pieces is we're trying to see about reducing potentially the number of days of the convention. Expenses relative to lodging is increasing. That gives our work teams a lot more time Saturday to get the convention center done. We're not breaking down early and heading up to get the banquet set up. So that's going to be a significant piece for the GO team relative to time. And that the reason for that is there are some revisions to the Sunday schedule. So first of all, the executive committee will be at 9 a.m. on Sunday. And then the Queen interviews will start at 10 a.m. on Sunday. And those will be on the second floor mezzanine level of the convention center. The chaplain will hold his worship service in the PAC at 10 o'clock. The flea market will go from 11 to 1 in the PAC foyer. Exhibits will be open from 11 to 3. The Queen's contest will be in the PAC from 1 to 3. And the memorial service is going to be 2 hours earlier, starting at 3 p.m. and go till 5. The intent, one of the pieces is a lot of our membership have said, it's Father's Day normally, how it falls. We want to do something with our families on Sunday night. We get into the convention center, do the memorial service, and then have the whole evening to go do family activities. So that's a little bit of a change for Sunday. Exhibits will be open on Sunday as well. Our vendors and our exhibitors like that idea. So exhibits will be Sunday, Monday, Tuesday. No Wednesday exhibits. And that allows us more time Saturday to set up, especially without having the banquet. The reminder about the convention book reports. April 1st. Get all your committee reports in, either to Jenny or to Chuck Walker. He's the new program book chair. He's taking over for Tommy, or for Danny Davis, excuse me. And we want to get those reports in from everybody, all the committees, all the officers, all those that provide that for the convention. We will be planning the first site visit for the convention center over the St. Patrick's Day weekend. We are planning to participate in the St. Patrick's Day Parade in Annapolis and Ocean City. So we'll work out the schedule for those that want to come down and do the walk through the convention center before the parade. We'll make all those elements happen. It works out a little bit better, and it's a less of a trip, and it gives people a chance to spend the weekend at the beach. So those are some of the major pieces that are going on. I'll pass over to Kate to talk a little bit about exhibits and training.
Do you want to come up for the exhibits as well? So far, we have 18 total vendors, to include a couple apparatus vendors and booth registrations. We're pretty much on target as we were from last year. We usually don't start seeing an uptick in registrations until end of March, beginning of April. We'll probably send out another reminder to the ones we haven't heard from yet from last year, and we've sent out already, like Ron mentioned, the packets to the ones from last year and some of the ones that we picked up at the MACO conferences. We're urging partners to get their paperwork in as soon as possible. Some of them do have specific requirements for power and tables and stuff like that, so the sooner they get them in, the better. I know some of them have already left, but I'll get with them this week, next week. They should have received their email last month. We have 26 seminar proposals received already. Some of them were from multiple instructors, so we'll be choosing one or two from each of those. We will only have classes Monday and Tuesday this year, so as not to conflict with everything else we have going on Sunday. We felt it was important for our membership to be able to be in the convention center for the exhibits, for some of the other items going on, as well as the memorial service. So we didn't want to keep conflicting with that. And this year we're looking at less classes. We've talked about it before. Quality over quantity is kind of our motto this year. I will be looking to Steve for PDIs for the instructors this year, so we need a couple of those to plug in, as well as confirmation on the skills that we have each year. So as long as we get those will be implemented. The March 1st deadline is for the seminar proposals. I did speak to Cindy Wright-Johnson this morning about some of the EMS that will be proposed, and we'll be working with MIMS again this year to offer CEUs for those classes. As far as, what else do you have for me? Just exhibits?
That's it.
Yeah, I think that's it for me. If anybody has any questions regarding seminar proposals or the vendors, or if they have anybody that they need vendor information excuse me, sent to, they can contact me or just visit the convention website. Everything is up to date on there. That's all I have.
Thanks, Kate. I know Ken and Ben, you've been working on programs. Anything that you have relative to program committee? Good, dear. Chuck, anything on the program book? I know he's back here somewhere.
Stuff went to the printer. Come on up to the mic, please.
They can hear you, but we want to also make sure it gets on the tape recorded.
Hi. So everything went, Tom sent everything to the printer, was getting ready to send everything to the printer. All the forms have been updated. Everything financially is going through the office. Anybody wants to put an ad in, if it's going to be by credit card, they can process it at the office. Everything's going to go through the office for a reason, because from this point forward, no matter who the chairman is, whoever's going to take care of that, everything, all the monies will still be coming through that office. So it's not changing addresses or anything. It always goes to the office. I know we set a date for putting the book together. I can't remember. I think it's the first weekend in May. Is that right? Okay. So, like I said, everything's getting mailed out. If it hasn't gone out yet, it should be going out this week. The mailer to everybody like Ocean City, all the businesses and whatnot that have got mailers before. That's where we're at.
Good, thank you. Tommy was here earlier. Him and Bill Hildebrand are working on production. The Go team is lined up. The host hotel, again, will be the Grand Hotel, and information will be coming out from John Denver and his group on rates relative to stays at the beach. Bobby, Mitch, anything on finance?
I think Laurie has a...
I have a question about the fire prevention interview times. Can that be moved back to when it was, we normally go in at 9, and depending on the amount of girls that are young ladies that we get, it's always been at 9, so. And we don't normally disrupt anybody else because we're upstairs.
Yeah, we can go earlier. We just can't go later because of the memorial service.
We definitely cannot go later.
If you want to start at 9, the executive committee will be going on in the PAC.
Yeah, we're always upstairs in the mezzanine, so.
So you want to start at 9 instead?
Yes.
Okay, we can make that work.
Thank you.
Cool. And then Randy, anything on administration? So there are copies of the draft schedule. I think everybody, the officers and executive committee got them. I'll give them to the secretary's table, and there are copies of the first mail-out letter that's going out with information. Any questions for the convention committee? So this convention committee meeting is February 15th, Wednesday night, Odenton, steering at 6, full committee at 7. Do you want to approve this agenda this month, or you want to wait to the next meeting?
It's up to you if you would like us to.
Any changes to 9 o'clock for the Queen contest?
Okay.
Yeah.
I'll entertain a motion. Motion by Tim, second by Robbie, to approve the presented agenda for the convention. Any discussion? Hearing none, all in favor say aye. Opposed, no. Motion carries.
Okay, thank you.
I'll make sure those updates are sent to the web team so they update. So for probably the next week, they'll still show some of the old times, but it will be updated shortly.
Okay. Ron, do you want to report on National Fallen Firefighters while you're there, or any other?
Absolutely. Real quick, couple of things. First of all, if you haven't heard, we're moving the memorial service to May. We're getting away from the October time frame, predominantly because of the federal government shutdown. Not that our government has everything under control, but sometimes they just aren't in the right mode of making sure the government stays operational. Twice we've been kicked off the campus when the government shut down, and we just don't think that's fair to the families to travel all the way in and not be able to see the memorial. So it's May 5, 6, and 7. It'll still be in Emmitsburg, and we are working through the number of line of duty deaths. Will be 146 that we'll honor. The numbers are increasing because of COVID, because of cancers, and now we are faced with the federal legislation acknowledging first responder suicides as line of duty death. So the number of honorees each year is going to continue to grow. So we're putting together a strategy on how we're going to address that. We don't have a case for this year, although the law enforcement community has one case approved that they'll be honoring this year. That'll be the first public safety suicide to be recognized at the national level. So I would be remiss if I didn't thank the Maryland Fire Service for all they do to help us throughout the course of the weekend and throughout the course of the year. pulling all the logistics together relative to the Memorial Weekend. On a personal note, I'm sure by now you've realized that I've announced my retirement from the foundation. I will continue to be the executive director until December of this year. The foundation board has hired a company called Vetted Solutions. They're located in Washington, D.C., and they specialize in nonprofit executive searches. So they've been working to bring together a list of candidates to the board of directors. They've appointed a search committee made up of 6 representatives. And the first batch, there's 16 applicants so far, will be reviewed next week. And there's still a 2-week open enrollment period, if I could say, for anybody that wishes to send a resume in. I highly encourage you to do that. And it's been a great ride, but it's also time to turn the keys over the car to somebody new and let them kind of take it to the next level. But I'm still going to stay involved. I am going to stay engaged in the fire service in some way. I just want to do a little bit slower pace. So thank you. That's the report of the foundation.
And Ron, we certainly appreciate you leading the foundation and everything that you've done. And we know you've looked out for everyone, but you've also had a special interest with Maryland, and we appreciate that.
Absolutely. So
Thank you.
Thank you. Questions?
Any questions? Anything else you have to report on?
I'm good. Thank you.
Okay. Getting back on schedule, Emergency Medical Services Branch. Emergency Medical Services.
Hi, Linda Dusa. My report was submitted. I hope you all got it. Real quick, I'm not going to go over everything. The group continues to discuss the pass rates for NREMT. We do have a small subcommittee that's working with Vice President Smothers to get data and to continue to look at those. And as everybody's fully aware, Vice President Smothers was elected as chair of SEMSAC in November. Dr. Jen Anders is his vice chair. We've had a couple meetings this year. One was the joint EMS and SEMSAC, joint EMS board and SEMSAC meeting, which we have every year annually. And then we had one on February 2nd, and that's the one where Dr. Chismar went over all the protocol updates. Our next meeting is March 2nd. There's continued discussion under the BLS subcommittee on the internship packets and the issues with getting evaluators for testing. MIFRE's working on that problem. One thing that MIMS asked us to do as a committee is to get the word out to EMTs that are due to expire to go onto the MIMS website and complete the renewal process. Every year they have a couple hundred people that lapse because they don't do that process. So if we can get that word out, that would be great. The EMS committee is supposed to work on that also. We had a long discussion at our last meeting about offload times in the ERs. As Dr. Chismar said this morning, they do have 2 hospital groups that are working on the offload processes. And I think recently things have gotten a little bit better. So hopefully we are moving in the right direction. Other than that, we're working on ongoing issues with EMS. Anybody has any problems or issues, get them back to the committee and we will address them as we can. Does anybody have any questions? Oops.
Any questions for the EMS committee? Thank you, Linda.
Thank you.
Training committee? Dan Stevens, high school, please. We're moving along.
Okay, thank you, sir. And I distributed, I don't know whether my report made the web, but I distributed a copy to all you all at lunch. So we haven't met with the State Board of Education, which we plan to do. We know the lady, and she wasn't available before Christmas, and we just haven't gotten to meet with her. But we plan to continue those efforts, and hopefully within the next month or so get to Baltimore to meet with her. There are several issues with this unfunded mandate that the state has given us that require all the programs statewide to switch to two-year programs with similar structures. In the past, these programs have been structured to meet pretty much what the local jurisdictions needed and what worked for them, and there were differences around the state. I met with St. Mary's County representative yesterday, and they have the same issues that they want more flexibility, and they are, I think their county commissioners are going to make contact with the State Board of Education to see what can be done. And they also expressed an interest that if it was desirable, they would travel with us when we go up to meet with the state folks. The financial burden is one of the things that folks are struggling with, and St. Mary's County solved it by going to an hour-and-a-half sessions each day, so that the EMT Firefighter 1 and the other programs that they are mandated to have will cover the 2 years. And if they don't do that, there's a lot of times that the local jurisdictions have to find somebody to, for want of a better word, to babysit the people that are in these programs while they are not in the MIFRE program. It's our understanding that some of the counties plan to approach, and other than St. Mary's, approach the state about changing some parameters of the programs so they can conform. We're hearing issues also this year of some class behavioral problems. That seems to be endemic as students return to full-time school following the pandemic-induced amended learning environment. So that's another thing. And I think I put in here, the EMT pass rate has been an issue with us. I see the EMT committee now is looking at it, and I've heard of others that are looking at this. The state is requiring the EMT program the junior year, and their reasons are wrong, and I've told them that, but they haven't listened to me. And there's a significant failure of EMTs in the cadet programs, and we think one of them is because the junior year, it's not going to solve the problem, but having the EMT the senior year will give them a little bit better chance of passing it, in our opinion, and St. Mary's County confirmed that with me in the meeting yesterday. So if any jurisdiction needs help, let us know. We'll be happy to work with them. And Tim, I understand that you all are working on Garrett County to try to get a program going.
That's correct. Jonathan, I'm not sure whether Austin was with him, they went up and sat down with Garrett County. Garrett County is looking to partner, Garrett County Board of Education partnering with Garrett College, I believe is the way the project's going to work.
Okay.
To start out with, I think they're going to start out with an EMT program, and then next year bring on a fire program.
Okay.
I offered your assistance if they needed it.
Okay, well, thank you.
I'm sure it wasn't. That's what I told Jonathan. I said, Dan will come up and help you. All you got to do is make a phone call.
We love to go to Western Maryland.
So
God's country.
it actually looks pretty good. The Bi-County Association went on record to support it. We'll do everything we can as the Allegheny Garrett to support that program. But
good.
We'll see how Garrett County does, and maybe we can even get Allegheny to do the same thing.
Yeah. Well, we certainly stand ready to assist any way we can.
Any questions? Any questions for Dan on high school program?
Okay.
Thank you. Good luck. Good luck with the meeting with them.
Yeah.
Rural Water Supply, Steve Berry here. He was here, okay. Standards, Ken Bush? Okay, we'll come back on that one. Let's go into Fire Prevention, Life Safety Branch. Sir. Mike? No, Mike Lecomte came to me. He's attending a funeral this afternoon. He'll be reporting tomorrow morning. That's why I skipped him. Thank you. No problem. Fire Prevention?
Start with Chief Phillips, please.
Thank you. Yes, for the Sprinkler Committee, very short report. I filed one. The highlights of it is we have one trailer still on the western shore. It's moving to College Park to be rehabbed and used by Prince George's County, or in Prince George's County, for a sprinkler demonstration. The second trailer is in Easton. It should be rehabbed the 1st of March, and it will be ready. The ongoing saga is the building that the one in Easton is in will cease to exist sometime the end of this year or the first part of 2024. So we are actively looking for some place to keep these things parked permanently. I think Teresa might have a place, and she's working on that. But if anybody has any good ideas, please contact her or myself, because they're going to have to go from where they are right now at some point in time. That would be it. Any questions?
Lord? Okay. Cindy? Yep. Are you doing this? Other than.
I sent in a risk watch report. I apologize it was late, but I have only had my eye open for the last 2 days. My personal message is go get your shingles shot. I'm getting mine in 3 months now. Our group has been working on a variety of new activities. We are hoping to be back in room 210, which worked really well for the on-site Sunday, Monday, Tuesday. I will reach out to Bill Hildebrand to confirm that before we actually set up our map. One of the questions that we will wait to get feedback on is whether or not we should bring the outdoor heat stroke display. We do have 6 in the state. Some of them are very, very active. Some haven't moved because of that 5-letter word that begins with C. COVID, that we haven't used in 4 years. So we'd like to have one of them at the convention outside, just to remind people that there are 6 across the state and they can be used. And that will be the kickoff for that from the federal government, as well as Safe Kids Worldwide, will be May 1st. We have not yet in 2023, knock on real wood, had any children who died inside of cars, but January is the only month that we've never had a fatality. So there's a lot of still awareness to be done. At the national level, we know there are some near misses, but that isn't a data point that's collected. We are trying to do that with the health department here in Maryland, with our child fatality review committees, when we can catch a child who was found and did not die, but was left alone in a car. The list of what we plan to do is there on the materials that I sent you. New this year, we are really going to advertise something for tweens and teens and run part of a babysitting training that is done at Winfield and a number of other stations across the state, but make that a role model. We'll also do burn scalds. The 2 pediatric burn centers are working with me to update all of that material. We have a Safe Kids meeting March 1st. Teresa's going to talk to you about the Pub Ed Life Safety Seminar, which is March 25th. The rest really are just a list of handouts. We do have a couple new coalitions and a couple changes. We have a new person at Tidal Health who'll be leading both Safe Kids and Risk Watch along with Sherry, and that is Kathy Nichols. And in Washington County, Katrina Wolf is now both the base station coordinator and our Safe Kids Risk Watch coordinator. We've also had a great partnership that continues to grow with Barbara Sue for Southern Maryland. Both Frederick and Charles County Risk Watch Safe Kids openings or contacts are open at the moment. And other than that, Thank you all for your support. I'm happy to answer any questions. I did bring Poison Center material. Poison Prevention Week is the third week in March annually, and if you want materials, you need to order them in the next 2 weeks for them to be collated by the pharmacy students and mailed out. There will be a mailing to every emergency department in the state. I'm happy to.
Is that free?
Yes. Yeah, the materials are free, and if you're in Prince George's or Montgomery County, you order them from DC. Anywhere else in the state, you order them from Baltimore. Happy to answer any questions.
Any questions for Cindy? Teresa?
First off, I'd like to say thank you for allowing us to present today. The committee's been working really, really hard. Our last meeting was a couple of weeks ago, in January. We actually had Dave Lewis come and talk and do his presentation on the peer support aspect. We thought it was important for the committees, and I asked that all the committees have Dave come because at points in times, it's an opportunity for a committee like ours that, the numbers really hurt sometimes. Watching the numbers happen last year was pretty upsetting at times for myself. It's a little personal when you work really, really hard and people are still doing things. Just to give you an idea, last year there were 3,500 fire fatalities in this country. From 2021, there was an increase of 660 from 2022. To 2022. That's too many. Noting that, as the fire marshal said, we had 64 last year, there's still some pending, so that number will probably decrease or increase. I like it when Penny sends the number and something's coming off. But what hurts is watching 2 people pass away this week in a residential. So Prince George's County did an event yesterday. They walked the community. Of the 70 homes that they inspected, half of them did not have working smoke alarms. This is 2023. There is no understanding of why people do not have working smoke alarms in their homes. I do not understand this. It's very upsetting. So, talking to Kerber, asking him what's going to be happening, I do see that the state of Maryland is going to have to get on a bandwagon to change another law that's coming to the 9-volt community. So you'll understand with the new presentation of the new alarms that are coming out, the code's changed in that aspect. They're being built. The 9-volt smoke alarm, UL will not give a standard anymore. He's already told me that in a couple of years, they're not going to physically put that UL sticker on there because these new alarms will not be able to be used. And that entitles to the hardwired. So we really have to think about changing our hardwired laws to go to the 10-year sealed smoke alarm and to ensuring that happens because they're not going to make the alkaline batteries anymore. They're going to be obsolete, and then we're going to have more people without that issue. So that's hitting kind of hard. In a couple of weeks, we go to North Carolina for some community risk reduction work with the fire marshal's office. In April, I've been invited to the National Fire Academy on April 14th and 15th to sit in the community risk reduction program. I really don't know what's going to happen there. They have this the agenda out, but it's still like in a work in progress. We'll be able to see and hear what the United States Fire Administration is trying to do as a whole. I will share that when I get that. I guess it'll be after the executive meeting, but Dr. Lori has a great mindset, and she has a vision for all of us, and we're all actively trying to get to the same level as to prevent fire deaths. As the fire marshal stated yesterday in the legislative meeting, Maryland has a fire problem, and we have to step up and we have to get out to our communities. There is no excuse that no fire department in this state does not have the ability to ask for a smoke alarm. We can get them. We have the ability through partnerships with PEPCO, with SMECCO, with the Delmarva Power, Red Cross. There's no excuse. And there's no excuse that every year we put out 2 days a month, 2 days out of those years, May and October, asking that everybody just go walk your community. And I guess I'm on a little tangent right now, but it's kind of hard. Coming from a very active situation, it just frustrates me that to know that we have the ability out there, but sometimes I feel like it goes on deaf ears. And as a fire marshal, I conclude to this. We have to change the mindset of our community. We have to make sure that they understand. Everybody has social media. Everybody has a way to communicate with their communities. Are you engaging your communities? That's what I need everybody to do. And if you want me to, I'll go talk for you. I don't have a problem talking. I actually like doing that. So invite me. I'm there for you because, as the fire marshal says, you're never too far in a state car. Thank you very much. So my next tangent. On March 25th, I hope you all have registered for the program that we have. We have Chief Ron Kinnerman coming from the FDNY, a personal friend of mine. I asked him to come because New York City has a very huge problem with the ion lithium battery issue. And we pretty much know, looking at case study, it's not going to the product that it's actually being built for. It's the batteries that they're purchasing off-site that they don't want to pay the several $100s, depending on the amount of money that is for the device, that they're going to this off-inferior that's not tested, that doesn't have a UL sticker, or doesn't say it's going to be working. And that's what they're having problems with. The second part, we're working with the NVFC to give us a second speaker. We'll know that on Monday. And they will bring insight about what we're doing for first responders. On March 30th, the UL, with partnership with the DC Fire Department and Alexandria, will be presenting a whole day presentation. Kate sent that out for us and all. And then we have in the afternoon, we break it out where we're working with a gentleman from Rockville, Bethesda, Chevy Chase.
Chevy Chase.
He is got, he actually sits for the Maryland. You can explain his job. I'm kind of, he's like the electric vehicle guy for the state of Maryland. Like, he's engrossed in this. But
He works for a company that networks across the Mid-Atlantic area to create the charging stations for electric vehicles. He is also a volunteer firefighter, an EMT at Bethesda Chevy Chase, has done internal presentations there and is coordinating this afternoon activity with Jim Resnick from Montgomery County Fire.
And we're getting an electric bus, and we're getting an electric car, a police car actually, from Rockville. Yeah, that's it, Rockville. So we have a full day planned. I hope you all register. As we are told, we have only the ability to have 100, but we give good gifts, so I hope you all sign up. And then thirdly, I know I joke around a lot about the cork bar, but Martha passed away. So she's the owner of the cork bar. That's why I'm a little upset, but just pray for the family. Martha was an auxiliary member for Ocean City for a long time. Her husband was fire chief, I guess deputy chief. Like, they're good people. They have always supported the fire service, and just say a prayer. Thank you.
Thank you. Hopefully, the presentation the finance team made and the executive committee supported today with additional funds for smoke detectors and fire prevention programs. You've got a very important message, and everybody, we know you're passionate. We just got to keep working. We appreciate what you do. Thank you for your report. Are there any questions for fire prevention? Laurie?
We did, I can tell you one thing, I have the presentation to show her. We do have the rules for the junior fire chiefs. We will send that to you guys so you can finish. I have to show her one thing on there, and then we'll submit it. But that is done and ready to go out, and then all the coordinators know that that's there for them to do that.
Okay.
All right.
Did you have something else?
Nothing.
Okay. Thank you.
Hey, Robbie, did you get my email?
Bob Cumberland, did you have anything from MIFRE Tech? You or Dan?
Not a whole lot there, Mr. Chairman. Thank you. Biggest thing is, right now, there's 3 of us that are due reappointment this year in 2023. That's our chairman, John Jerome, Chief Chairman of Howard County, myself, and Chief Jennifer Litz from Baltimore County. Our appointment's up this year. Don't ask me when they'll do that or if we'll do it. I know my last appointment before 19 took to about 21 before I got reappointed, and I asked not to be reappointed. And unfortunately, I'm the longest serving member on the commission right now. I replaced past President Charlie Raleigh when he got off, and that was back, I think, in 1991. So it's time for me to move on. The other big thing, and we just got emails from one of the commission members wanting to look at House Bill 470, Senate Bill 256, with the plywood and that the structure, outlawing that from being burning. And I think we on the commission all agree that it's got to go. But I think we haven't had our meeting. We have a special meeting. We're going to probably make some recommendations to the committee or to the people who sponsored that bill. And right now, Dan Makowski serves on our commission, and UL is looking at doing studies to replace that and stuff like that. And I think the big thing out of that, from my perspective, I think we need to support that bill, but I think it should go to summer study so we have a better idea of what we can use to replace it, stuff like that. And if we do use, live structure buildings for our training and burning, you're almost tear the whole house apart before you can get in there and burn it. So you won't have anything to use to train to begin with. So I think we need to look at how we can either protect our people better or what needs to be replaced as we go along. Them buildings out there, we're still going to have to fight fires in them, so we got to have some type of protection to look at that. And from the commission standpoint, I think it's a key thing, and it's our responsibility to look to give suggestions in what we want to do. So I think a summer study for those 2 bills would be great if we can get that done. I know Virginia passed it, and I think maybe Bob can answer that better than I do. They're looking at maybe a pattern, something around what Virginia did.
Virginia passed it. We had much discussion on this just yesterday in the fire marshal's meeting. This bill came up last year. It didn't grab a lot of traction. It didn't get passed. It's back again in its same form this year. For those of you that don't know, what this bill basically, or these bills do basically, is prohibit the use of OSB board for training purposes only. Now, OSB is wood chips that are bonded together, and it's the bonding agent that seems to be the issue. When this bonding agent is burned, the gases it gives off seem to be more toxic, and it was based on a study that was done. The long-term effects of the burning of this board and being in proximity to it for training purposes doesn't apply to, you get the same gas as if you're fighting a fire. For the most part, fighting your fire, you should have, if you don't, you're not doing things right, you should have your breathing apparatus on before entering. After you come out, of course, you take your gear off so you're not getting the off-gassing. You can't use it in fire training. A question came up, and you just alluded to it, about using a building as a live fire prop. And there's an interpretation in here about the definition of training and burning this stuff. In a training environment, you don't burn through or burn the material in and of itself. So if you're using the building as just a training prop, you're setting a fire like room and contents and put it out. A stretch of the definition, that still can be used. It's open for interpretation to who's reading it, but that was a conclusion that was brought up yesterday. At the end of the training, if you decide to burn the building down and you don't go near it, again, the interpretation that has been put forth is that that's still allowed. You're not in the building burning it when it's burning and giving off this terrible gas that we're not supposed to be around, these fumes. Just for the record, the MSFA has gone on record in support of these bills. We were last year, and we are again supporting them this year. The gentleman that was just alluded to, what was his name? He's with UL, or used to be?
Dan Mikowski?
Yes. This gentleman, if you watch him, he's full of information, and it's all good information. Do not take wrong what I'm telling you. It's just difficult to sit and follow his entire presentation because it's very, very scientific. He doesn't speak in layman's terms, but he's quite knowledgeable about these things. I believe a study has already been done on this. And this was the basis for these bills that we had last year and again this year. But just as a matter of record, the MSA is supporting these bills.
Right, and I did pass that on to the commission when they called for, because you need 6 commissioners to approve for a special meeting. So I did want to, and I also, when I did that, told them that the MSFA Legislative Committee was in support of the bills. Like I said, I support the bill myself, but I think we need to see what we can do to help our people, when we run into this, not only in training, but like Bob says, it ain't even a live fire because that stuff is out there. So the other thing in that bill, it's not a lot of money, but they want the money that if you do it, they're going to fine you. First fine's like $500, second fine's like $1,000, and that money they're going to put back in the general fund. I think we ought to try somehow to support that, to put it back so that the fire service gets that money, even though first year calculation may only be, I think it's only $55,000 or $57,000. It's not a lot of money, but it's costing the fire service money, for training. So I think we ought to look at maybe having that money go back to the fire service and not into the general fund, because I don't, it isn't going to take that much money away from them, if that's what they're looking at. Question.
You made reference to the Virginia law. We learned in our meeting on Friday, somebody read the Virginia law to us. There is a specific exclusion for acquired properties.
Okay. So, I'm supportive both of them. I mean, and I can't speak for the other commissioners. I mean, Dan and I have had because Dan's on the commission. Dan and I have had, and I think Dan's in support of the bills also. But we need to look at them. That's our standpoint from the commission. And within training, the commission sets at the top, comes on down.
Any other?
Another thing that's come up over this, they talk about the OSB board specifically not being used. Then the question is, what can we use?
Yeah.
And people were talking about plywood. Plywood is different in as much as it's more wood and less bonding agent, and the bonding agent's actually different in plywood than it is with OSB. So plywood can still be used. A question was brought up about how about if you cut up the OSB into small stuff like splintered wood, and it's still OSB. It's still the same bonding agent. So there is a lot of I call it the domino effect. One domino knocks over another one, and where does it stop? There's still a lot of unknowns with this, but the basic premise is to make the fire ground safer. Specifically, and this is where it comes from, for the training instructors. Because they're around the stuff all day long, whereas the people being trained are exposed for maybe a half hour or 45 minutes in an 8-hour period. The instructor, they had an instructor that actually died, and they attributed his death to being around this stuff 8 hours a day, 5 days a week for I don't know how many years. That's where it came from. It's designed to specifically, by name, protect instructors, but it also protects our firefighters. Where's it going to go? We don't even know yet, but right. That's basically what he's talking about.
Any other discussion? Any questions?
One last thing from the commission. We have a long-range planning committee, and being in co-chair with Kevin Lewis from Washington County, who is also a commissioner. We're looking at and want to bring all the training agencies together because they fall under the commission, and try to develop a statewide training program so that we're not going in all different directions. So that's on the table, and once we've now gotten out of the pandemic and everything, we're probably going to be calling those people all together, the heads of those groups together, to sit down, because I know MSFA's training committee was looking at our 10-year plan. So we want to bring all those together. So that'll be happening somewhere down the road here very shortly. Other than that, that's all I have, unless anybody else has any questions. Thank you.
Any questions for Bob? Thank you. Sir, any committee or anyone that needs to report today? Come on up, Chief. President, sorry about that. There's just a little bit of glare coming in the window, not as much as this morning.
On behalf of the individual that won the Station 50/50, he's donating it to the MSFA Scholarship Fund.
Oh, okay. Thank you. Past President Faust.
Good afternoon. Just a quick update. I know Dennis Beard submitted the Memorial Committee report electronically. He's not able to make it this weekend. I was asked to take over the gala as the chairman of the gala. I gave everyone a flyer this morning. I just want to let you know that the gala is September 23rd in Annapolis at the Doubletree. We are currently looking for sponsors. We do have there's an email address on the flyer that I gave you. If you send an email to that, whether it's regarding to sponsorship, tickets, whatever it happens to be, it'll be forwarded to the correct person. So if you know of anyone that wants to be a sponsor, or if you know anyone in your local fire company area that may be an artist, carve decoys, paint pictures, whatever, that might want to donate something, please send an email to that email address that's on there. Also, any old coins you may have at your fire station or patches you want to get rid of, let us know. We'll try to put a basket together for the silent auction for those things. And last, I'm also the president of the Kent and Queen Anne's Association, and we are having Dave Lewis, I know it was spoken about a couple of times today, about the peer support. We're having a session at Sudlersville on April 29th from 9 a.m. to 11 a.m. If you're in the area, please stop by. There's no registration, just come. If you haven't had the course yet, I've not had it, but I've heard great things about it. And so for the Kent and Queen Anne's, we'll be putting that on again. It's April 29th from 9 a.m. to 11 a.m. Thank you very much.
Thank you. Is there anyone else that needs to come on up, sir?
Sorry, I wasn't planning on coming to the mall. Have a great time. Today was my first day coming to one of your meetings. It was great. Thank you. I wanted to bring this up. I had not heard about this at all. We talked about this name change, and kind of sick of it in a way, because we're not focused on one problem we have in state of Maryland right now. It is a recruitment intention. The volunteers we need today, we don't have the funds. We don't have the money to maintain stuff. We don't have the staffings. We just closed 3 firehouses down in PG County. Anybody from PG County would tell you in this room. Chief President, I think that was the name, and a couple other ones. Firehouses, volunteers are in danger of losing out here. We need to help them more. The big question we asked, is Southern Maryland asked the second vice president last year, how do we maintain the middle-aged firemen, the new middle-aged firemen? Well, one of this is, if I can go back to my age, back in 2013, I had medical problems with my teeth. I had medical insurance, but I did not have dental. I went through major pain, access, golf ball, everything. Pain after pain after pain. Antibiotic, pain medicine, antibiotic, pain medicine. Unfortunately, you know, when you start taking pain medicine, you can get hooked. Good thing is I didn't get hooked. But you go through it. I was begging for help, trying to find help. There's nowhere to help. Thank God I did find help, and we actually went around Medicaid and got Medicaid paid for the hospital and surgery, and got the other funds through a program. Thank God. But here's the problem. What do the volunteer offer us? Calvert County offer property taxes. Okay, that's good. We offer tax break. That's good. Okay, what about the people who don't own property? Rent. About the people who might not claim taxes for so many years? I did not work. I finally picked up this job selling baskets, cotter pins, everything. Now, what I'm doing now, I love that job because I can meet other fire department and working with the fire department. And I hope I can meet more of y'all soon. And now I'm working a little bit, but I don't have dental insurance. So I still got Medicaid, Medicare, all that stuff. But the fire department don't have nothing to give. Medicaid, Medicare, dental, nothing. It might be a grant out there, maybe it can help kickstart a medical program for volunteers, maybe help the volunteers to have some benefits. Maybe they will stick around for a little bit for that. Something like that. We got to focus on keeping the volunteers here. If we not, we're going to start closing the firehouses down nearby here, day in, day out, and your taxes going to go through the roof. And I hate to say that. And I love being a volunteer. I've been over 16 years, and I respect every last one of y'all because y'all was the lead our way, and I try and help y'all out. But where are the young ones at? They're not coming up. So we need to bring them up here. So I know I'm not trying to preach to the crowd. I know y'all are trying to do this, but maybe next go around, maybe put a team together, trying to see maybe you can put a medical team together, maybe trying to see if it may be a benefit out there you can find. Maybe it will work with the volunteers, just like a job, because I know AFLAC would do that. And then fire department might can take over after the kickoff. They're saying, maybe you all can look into that. Thank you.
Thank you. Appreciate your comments. Anyone else? We're going to recess today, but before we do, I want to say thank you to each and every one of you. We've had a very productive meeting today. It's been very peaceful. We've been able to hear, hopefully you've been able to hear, because we haven't had a lot of side conversations, haven't had to use the gavel, haven't had to have the quiet sign held up and all. So I want to thank you for all your support, because it's made it much easier for us to hear the reports and have the dialogue. We've gone through today's agenda and some of tomorrow's agenda. We will come back tomorrow morning at 9 o'clock, but hopefully you'll take this afternoon, a nice semi-sunny afternoon, and enjoy some of the sights in Southern Maryland. Before I call on the chaplain, President Kurtz, any comments? Yeah.
Okay, Patrick, if I'm correct, except for this row, everything else can stay. Is that correct, Patrick?
Where that door jam is, make it behind you. Everything on this side, you are safe. This side here is going to have to get tight.
They're going to have to move the apparatus back in. So we'll be moving this row. Take your name sign. But Mr. Chairman, no, thank you to the executive committee, to the membership, and to the officers, and to Prince Frederick. Patrick, once again, thank you for hosting. I think it's been a wonderful day. Thank you.
Oh, go ahead. Breakfast starts at 8 o'clock tomorrow morning.
Breakfast tomorrow morning at 8 o'clock. And
These three tables will get real tight, so whatever is taped down here, that power, got to come up. That power cord has to come up.
Vice President Smothers, do you have anything?
Not really. I think Ben said it all. I think it was a good meeting today, and go out and enjoy the rest of the evening, and carefully in your travels.
I don't have a backup alarm going, but do you have anything?
Thank you, Chairman, for your witticism there. Pleasure to have been here today with Southern Maryland. As always, I'm just about 45 minutes directly straight across from you, but it takes forever to get here. Thank you very much. And I don't think anybody's parked in back of me, but if you are, move before I back up, please.
John, move. He's backing up. Ladies, do you have anything? Okay. Chaplain Long? Tomorrow morning, we're starting at 9. Okay. Now it's you.
I'll be done by 10. I got a couple prayer requests came in today. Denise Caldwell from Level is recovering from a cardiac event, and Mary Morgul, past president at Cabin John Lay's Auxiliary, passed away last night. So please join me in prayer. Almighty God, we just lifted up some concerns to you, Father. We ask that you be with the family of Mary Morgul, and as they deal with this incident, we pray for recovery for Denise. And Father, as we depart this evening, we thank you for the fellowship that's going to happen, Father, and for those who are leaving, we pray for safe travels. And Father, especially watch after our folks who are responding to calls, protect and guide them. We ask this all in your name. Amen.
We're recessed until 9 a.m. tomorrow morning.
Yep. For a little while.
See ya. This side of the door, camera, this side of the door. He said.
Exactly. Yes, what the hell?